Alam naming nag-aalala ka.
Kaya ginagawa naming lahat ang aming makakaya.
Para safe ka dito sa ospital. Ang ospital at medical staff ay nakasuot ng protective equipment. Tuloy-tuloy ang disinfection sa lahat ng areas sa ospital. Ang bawat pumapasok, kinukuha ang temperature at mga detalye para sa contact tracing. Sinisiguro din na may tamang social distancing ang mga pasyente. Hiwalay ang lugar sa mga regular na check-up o procedure. At sinisiguro ang mga equipment at kwarto ay sterilized at malinis.
Kaya huwag kang mag-alala, safe at alaga ka dito.
Safe at alaga kayo rito.
Safe at alaga kayo dito.
Dito sa VRP Medical Center, nakahanda kaming magbigay serbisyo sa bagong panahon. Para sa iyo at sa pamilya mo. Ito ang alagang VRP.
People can metabolize regular folic acid due to MTHFR genetic polyp. It maximizes the benefits of folate supplementation that helps in preventing neural tube defects. For elderly, it helps lowering homocysteine levels and it helps prevents diabetes, hypertension, cardiovascular diseases, and improving cognitive function. Quatrefoil is also safe and ideal for women planning pregnancy, pregnant and lactating women. Quatrefoil can be taken once a day at 400 micrograms per capsule, active folate by children, adults, and elderly. These people with folate deficiency to address concerns for macrocytic anemia, hyperhomocystinemia, mood impairment and depression, cognitive functions in elderly people, cardiovascular protection, sport nutrition, and bone health. So with the many benefits of active folate, Quatrefoil surely sets the highest standard and raised the bar in folate supplementation. Quatrefoil, the only active folate for your quality life.
Good morning, everyone. Thank you for joining us for this morning's activity. I am Dr. Maria Rebecca Agkawili, and I am the moderator for this morning's activity. To start off, let me call back Dr. Arian Orbanos for our opening prayer.
Let's put ourselves in the presence of the Lord. Almighty and loving Father, creator of heaven and earth, we praise you and adore you. You are the King of Kings, and we humbly ask for your forgiveness for our sins. Father God, thank you for allowing us to gather today and be able to share our knowledge. And as your Holy Spirit to be our guide, deepen our comprehension, and give us the wisdom to understand every topic that we are going to discuss today. May this meeting bring success and growth to each and everyone gathered here today. All this we pray through our Lord Jesus Christ. Amen.
So depending on your tolerance ng pain, it will also get more painful over time. Okay? Also, yung false labor, they start in the front lang of the abdomen. So minsan, isang part lang ng abdomen mo yung titigas and then mawawala. And then after a few while, sa ibang part naman ng abdomen. While in true labor naman, it usually okay. So if you feel that you are through labor, the next question would be, pupunta na ba ako sa ospital? Kailangan ko na ba tumakbo? Tatawagan ko na ba yung OB ko? So, ang ginagawa ko, I tell my patients, I give my patients the 411 of when to go to the hospital. So, what's the pupunta sa harap? Usually, so the 411 is when you get contractions every 4 minutes. Each contraction would last 1 minute na for an hour. If for an hour, ganyan yung pattern ng contractions mo, then go to the hospital na. Okay. So here are the reasons to go to before 37 weeks if there's decreased fetal movement, if hindi masyadong malikot si baby. Pero syempre, there are no hard and fast rules. It's better to go if you're unsure, or you can call your OB. You have to listen to your body and follow your instincts. It's better to be safe than sorry. So once you go to the hospital, once you arrive, you will be directed to the examination room. So the nurses will ask you to change into a hospital gown. Your vital signs will be checked, and then a pelvic examination will be done. So if nag-break na yung bag of water mo, then a speculum exam will also be done, and then an internal exam will be done by the resident to check if you're dilating na or not. You will also be hooked to a fetal monitor to check the baby's heart rate, no? And if you and your contractions. So once it is determined that you are already in labor, hindi ka agad-agad na pag sinabing dilated ka na, manganganak na. It's not like in the movies na nasa bahay pa lang sumasakit na yun siya, tapos the next scene, may baby na. So it's not like that. So we have to go through the stages of labor. Okay. So the first stage would be the first stage of labor is the start of the uterine contraction, and when your cervix goes from 0 cm to 10 cm or fully dilated. So this stage is broken down into two. This is an early phase or the latent phase of labor when you go from 0 cm to 5 cm, and this is characterized by a slower cervical change. In average, it lasts about 8 to 11 hours. However, yung iba, it would last more than 24 hours. Because this phase is the longest phase, patients may still be sent home if they live nearby or if they are considered low risk. Some would be asked to come back for reassessment after a couple of hours. Most of the patients, however, who are already at 3 to 4 cm, they are already admitted because they are expected to reach the active phase of labor not before long. So when you hit 6 cm, then you are now in the active phase of labor. Your cervix will be dilating more quickly. For the first-time moms, approximately 1.2 cm per hour ang dilatation natin. So your contractions will get stronger and closer. At this point, pwede na rin pumutok yung bag of water mo kung hindi pa siya pumuputok. Kung wala ka pa sa hospital by this time, please go to the hospital na. Okay? So don't be surprised kung yung excitement mo biglang mawala muna as your labor progresses because of the discomfort that you're feeling. So if you feel that you need to have pain medications or anesthesia, you just tell the resident on duty or your doctor so that we can also inform the anesthesiologist. So usually the epidural is started during the active phase of labor. So this is the setup in BRP. So you will, after being admitted, you will be brought to the labor room, no? And then you will be hooked to a fetal monitor. If kaya pa naman, you can be allowed to walk around, and sometimes we also allow you to eat pa if hindi pa naman malapit ng mga anak, no? Kung nasa early phase pa tayo ng labor or if wala pang epidural. So someone will come in para i-check your vital signs from time to time, and the progress of labor will be checked via pelvic examination. So i.e., no, usually every 2 hours or as needed. So once fully dilated na, this is now the second stage of labor. So this is the active pushing phase where you get your baby from inside the uterus to the outside world. So for first-time moms, usually with an epidural, this could take up to 4 hours. So you have to expect that you have to do a lot of work during the stage of labor. Kaya nga tinawag na labor, no? Kasi, yeah, you have to do work. So labor of love naman to, and napakaganda naman ng reward mo after mo mailabas si baby, no? So once you're fully dilated, they will transfer you to the delivery room where you will start your pushing. Yeah. So your doctor will ask you to bear down during each contraction or tell you when to push. Or if you feel the urge to push, then gora na tayo, no? So after your baby's head is delivered, the rest of the body will follow shortly. And then once the baby is delivered, this is now the start of the third stage of labor, and this will end when the placenta is delivered. So this stage is also called the afterbirth, and this is the shortest stage of labor. It may last from a few minutes to around 30 minutes. No? So at this point, you may still feel some contractions, but they will be less painful. If there is an episiotomy or a tear, it will also be done during this stage of labor. Also, at the third stage of labor, we also do the unang yakap or yung first embrace. No? This is ginagawa yung early skin-to-skin contact, which Doc Elaine, you will be discussing further in her discussion later. No? So ito na yung reward mo, first bonding yun ni baby. So once everything is okay na and na-repair na yung mga tears natin or yung episiotomy, bleeding is controlled, you will now be transferred to the recovery room, and then you will be expected to stay there for around 2 hours for observation, after which you will be transferred to your room. So the Alagang Ina will be having another discussion on afterbirth naman, which is the puerperial stage, in the next module. So you have to also watch out for that lecture. Okay, so that's it po. So that is labor and delivery. So hopefully by this time, nabawasan na yung kaba nyo at saka alam nyo na what you have to expect when you go into labor. Okay, so good luck everyone. And just enjoy your journey of this during the pregnancy. Thank you, Doc Becky.
Thank you, Dr. Chu. I am sure your lecture helped on how to determine if you will go to the hospital or not. Now, very detailed on what to do to yourself when you think you're in labor. So now the first lecture is over. Now we offer raffle prizes for the participants. May I call in Dr. Urbanos to conduct this first raffle and to show us the exciting prizes. So just to inform everyone, after each lecture, we will have a raffle. So please stay on because you have to be present to claim your prize. And the prizes are very nice and useful for your pregnancy and delivery and after. We will also have trivia questions about the lecture. And those who can answer, the participants who can answer the question from the speaker will get special prizes. Parang ano lang, nakinig kayo ng lecture tapos may quiz after. So listen well, take notes, and get your special prizes. Dr. Urbanos?
Hello, Doc. Yes po, Doc. So we have exciting prizes that we prepared for all of our participants this morning. So, sir, share ko lang. Can I share po, sir? So for this morning, we are going to win 3 winners of travel adapter, 3 winners of digital alarm clock, and 3 winners of luggage scale, digital luggage scale. So this po yung ating mga prizes for this morning. So for this morning winners, Sir Harvey, paki-show po yung mga winners natin. So for the 3 winners of travel adapter, Miss Mary Ann Galenzoga Morada. Next is Miss Armina Abelar. And the 3rd winner for our travel adapter is Miss Joanne Medrano. For the 3 winners of digital alarm clock is Miss Luis Jane Bueno, Miss Claire Franco, and Miss Carmina A. Sanchez Tandiama. And for the last batch of winners for this morning is for the first part of raffle draw is Miss Rona May Santos, Mr. Patrick Franco Payuyo, and Miss Genevieve B. So all of the winners po can claim their prize here at VRP Medical Center at the delivery room, 4th floor po. We will contact you po on how to claim your prize po, Doc, and where will you claim it po.
Okay. Thank you, Dr. Urbanos. Now we have the question from the speaker for the special prize. Dr. Urbanos, what is the special prize for the winners who will answer the questions?
So these are the special prizes po that yung mga active participants natin. So naghanda kami para makinig kayo ng maayos. Sir, so these are the winners po for those who will participate and who will correctly answer the questions from our speakers. So these are the bedroom and linen spray and scented candles with diffuser from our sponsor, Corbridge po. So dapat makinig kayo and listen to our speakers because there are special prizes for those who will participate. Thank you.
So we have two questions for two prizes. Dr. Chu?
Yes, Doc, I'm back. Okay, so my first question would be, so what is the 411 of when to go to the hospital?
So yung first winner is dun sa chat box. You can type your answer sa chat box.
Okay. The second question?
And then the
Ditas,
second
Dr. Ditas.
question would be, aside from the 411, give me one other reason to go to the hospital. So medyo madami ako in-enumerate doon. So aside from the 411, ano pa yung reason mo to go to the hospital? So very easy naman yung question.
Very easy. Yes. So since the answers will be in the chat box, we can announce the winners later. Okay. Thank you, Dr. Editas. Thank you,
Okay,
Dr.
Doc. Thank you po.
Urbanos. So we remember we only have two winners for this segment of the lectures. Okay, so we move on to our second lecture in the interest of time. So everybody fears about pain during labor and delivery. But pain is addressed by our friendly anesthesiologists. So do not be afraid. Many deliveries now are relatively easy and pain-free. So let us welcome Dr. Paolo Agna, a consultant of the Department of Anesthesiology of the VRP Medical Center, to enlighten us on how you will be very, very comfortable during your labor and delivery. So you will not be afraid to have many babies. Thank you, Dr. Paolo Agna.
Yes, ma'am. Good morning, everyone. So I'll be giving a short lecture about the choices for labor management, labor analgesia, and pain management during labor. Mhm. Wait lang. No.
Okay.
So here's my the amount of pain felt during childbirth is different for every women. So some women, the techniques learned in childbirth in the childbirth classes are enough to relieve the pain. Some needs medication as necessary. For other women, the options of having pain relief medication available to them during labor and delivery is appealing, and when used may help them experience a more comfortable childbirth. So our objectives for this morning is to optimize patient comfort while minimizing the potential for maternal morbidity and mortality. So the pain of childbirth is the most severe pain most women will endure in their lifetime. So women in pain don't need the indication for this pain relief. So the goal is to deliver the infant into the arms of the conscious and pain-free mother. So our ideal obstetric analgesia is to attenuate maternal anxiety, fatigue, and deliver the healthy baby. Drugs should not affect the baby, easy to administer with minimal monitoring, rapid and consistent analgesia with preservation of uterine contraction, and it is easily reversible. So for the risk factors that the risk factors for suspected difficulty intubation. There are some conditions that the anesthesiologist may encounter that they'll have difficulty while doing intubation in case general anesthesia is needed. So as you can see, there's the receding jawline and receding jaw, protruding teeth, and small mouth, as well as short stature, short neck, and anterior neck mass as it's like a goiter. So for the laryngeal edema and bipedal edema, mark obesity, as well as spine deformities. So for major conditions which present as a risk factor for doing difficult anesthesia to patients are the cardiac, pulmonary, or neurologic disease, as well as bleeding disorders, and for preeclampsia and eclampsia, as well as history of anesthetic complications like malignant hypertension. So we have these techniques, the system techniques that we can use for relieving the pain of the mother. So number 1, systemic analgesic. Number 2 is local infiltration. And 3, general anesthesia. And number 4, regional anesthesia. So these 4 I'll be talking about in detail. So number 1 is a systemic analgesic. So pain relieving medicine that is injected into your vein or into your muscle. It acts in the entire nervous system rather than just a certain part of your body. So pain may be dulled but may not be eliminated completely. So usually it does not slow down labor or interfere with the contractions, but may cause drowsiness to you and your baby. So as you enter the labor room, if you feel anxious, we can give you a mild sedation. So usually we can give you low dose of opioids. And
I need to go to the Valley Verde before I make rounds before St. Rita.
low dose opioids for you just to give you a mild sedation.
Doon na lang tayo mag-lunch. Invite
So for local infiltration, so this is local infiltration is done by giving local anesthesia at the specific site of the procedure for where cutting is needed. So the episiotomy. So usually, when you have to deliver the baby, the OB-gynecologist needs an episiotomy for the baby to come out easily. So the local anesthesia is a numbing medicine injected in the vaginal or rectal areas by your obstetrician at the time of the delivery. So here are the types of the local infiltration. You can do the potendal block, usually done to lessen the pain as the baby is being delivered in, and to numb the area for an episiotomy if necessary. So yung location niya is inside the vaginal. Then the paracervical block. So we inject the local anesthesia at the 3 and 9 o'clock position at the cervix. So when is the local infiltration is done? So it's either before or after the episiotomy, and it is done around the wound. So here is a picture. So where we can do the local infiltration, and sometimes we can give you sedation. So while giving you the local anesthesia, we can give you a mild sedation. So for general anesthesia, it is a medically induced sleep while loss of protective reflexes. It may be given intravenously or inhalationally. So sometimes if hindi siya kaya ng local infiltration or hindi siya kaya ng intravenous route ng medication, we just we use the anesthesia machine to provide you the comfort that you need. So here are the types. So now the first is the inhalation anesthesia. So inhalation anesthesia is used with oxygen, and in the recent studies, it suggests it has an effective labor analgesic compared with the nitrous oxide lang. So we use sevoflurane, isoflurane, yung usual na inhalation medication that we can give. So the only downside for this technique is it needs special equipment such as the anesthesia machine, and it gives you more intense sedation. Like I said while ago na kailangan mawawala yung reflexes ng patient. So number 2 is the intravenous anesthesia. Here, this is the two medications that we usually use, propofol and ketamine. So both are used to make you fall asleep instantaneously. So the only difference between these two is the ketamine cannot be used in the hypertensive patients. So it will cause rise in the blood pressure. So the side effects of the intravenous anesthesia. So the fetus, the baby can have fetal narcosis, cardiorespiratory depressant, hypotension, hepatitis, necrosis, increased blood loss, and aspiration of content and particulate matter for the mother. But the risk factors are just minimal, and as long as the anesthesiologist is on your side, we can protect you while the reflexes are gone. So aspiration during general anesthesia, here are the prophylaxis. So how can we prevent the occurrence of the event? So at least we have the fasting for 8 hours, use of agents that reduce gastric acidity like ranitidine, omeprazole, and skillfully tracheal intubation. So in case the event arises. So others are the passage of NGT tubes, weak intubation, or use of regional anesthesia when appropriate. So here are the reasons why we do the general anesthesia. So when the blood cannot clot properly, so magiging madugo. So if you need cesarean suddenly and there's not enough time for regional anesthesia to work, abnormalities in your back that may have difficulty, as yung picture kanina na nakita yung medyo tabingi yung spine, we'll have difficulty in doing the regional anesthesia. And occasionally, a spinal epidural anesthetic can be put into the right place. So, yan, or doesn't work properly. So, number 4, here's the the last technique. So, as you can see, there are two kinds of regional anesthesia, is the epidural and the spinal. So the difference of this is where to put the medication. So first, we will explain the positioning. So usually, when we introduce the needle, it's either on the sitting position or lying on your side. So kung saan kayo mas komportable and kung saan mas magiging madali yung paglagay nung needle. So here's epidural anesthesia. So epidural anesthesia, we introduce the needle into the epidural space, and then we introduce the catheter where the medication will be given. So yung kinagandahan dito is there is a catheter that will provide you medication for long hours. So once you have the pain, we can give you the medication through the catheter. So hanggang paglagay, hanggang pagpanganak nyo, pwede natin mabigyan ng gamot. So dire-diretso lang. There's pain relief. We can give you pain relief for hours. So usually we only give a small amounts, so it will be safer for you and for the baby. So once the medicine takes effect, you should feel better, but you may feel some back or rectal pressure. So entirely hindi mawawala yung sakit. There's just we just decrease it to a bearable amount that you feel more comfortable. So yeah. So the complications, so ito yung some of the complications that may arise. So for the immediate, total spinal blockade, hypotension, urinary retention, headache, central nervous stimulation, meningitis, and cardiorespiratory arrest. But the risks are very low. So for the long-term effect, there will be backache, neck pain, tingling hands, and frequent headaches. So here are some of the contraindications for the epidural anesthesia. So actual or anticipated hemorrhage, infection of the near side of the puncture, suspicion of a neurological disease. So the other regional technique is a spinal anesthesia or subarachnoid anesthesia. So the spinal block is similar to an epidural and it provides good relief. The only difference is that the medicine is only given at one time. So hindi na siya pwede ibigay ulit at that moment at a different moment. So the difference is that only one time in your back and it only gives you pain relief from 1 to 2 hours. So spinal block is often used for women who are giving birth vaginally and when the baby needs to be helped out vaginal canal with the use of forceps or vacuum extraction. So the possible side effects of the spinal block are the same as for the epidural. So both epidurals and spinal blocks may be given for cesarean sections. So another form of the spinal block is a SADA block, which is used to numb the area of buttocks, perineum valve, and the vagina. So we give you a one-time pain relief with a very low dose, just to provide you pain relief from those lower parts, such as the buttocks and the vagina. So the complications are same for the epidural with a minimal risk. So spinal anesthesia contraindication, same as the epidural. So the obstetric complications that are associated with maternal hypovolemia, hypotension, with the disorders of coagulation, defective hemostasis, infection of the puncture, neurologic disorders, and significant aortic stenosis and pulmonary hypertension. So the advantages of the anesthetic compared with general anesthesia is it's usually safer for you and your baby, lets you and your partner share in the share with the birth, not sleepy afterwards, better bonding of mother and baby, better pain relief afterwards, and baby will be more alert when it's born. So that is my short topic for this morning. So thank you.
Thank you, Dr. Agno, for the lecture. So I'm sure most of you are already enlightened on how not to experience the screaming and shouting of labor pains. So there is a way to alleviate the labor pain that are safe for you and your baby. Thank you, Dr. Agno, for your lecture. Now we go back to another raffle with Dr. Urbanas. So listen up for your names to be called. So Dr. Urbanos, what prizes do we expect this round?
So for this morning, they will win, 9 winners will win Unilab loot bags. So this one.
Okay.
First winner, Miss Christy Sarah. Next is Miss Tisha, Doc Tisha Bermejo.
Tisha.
Next is Miss Maria Lourdes Rivera. Fourth winner is Miss Donna C. Enciso. Fifth winner is Miss Zani Reyes. Next winner is Miss Cristina de los Reyes. Next is Miss Melody Ann Pablico. And next winner is Miss Igan Evangelista. And for the 9th winner for the Unilab loot bag is Miss Eliza Ericel P. Santos. Congratulations. You can claim your prizes here at VRP Medical Center, 4th floor delivery room. We will we will contact you and send you the information on how to claim your prizes.
Okay. Ariane, we have prizes for quiz questions
Yes
again.
po, Dr.
Yes.
Agna po,
Dr. Agna
one
will
winner for
one winner for a special prize again.
Yes po, Doc.
Dr. Agno, you have your quiz question.
So I just have one question for the
Yes po.
participants. So just give one technique that the anesthesiologist can offer for labor analgesia. So there are 4 techniques, just give one.
Okay, thank you. You may type your answer. And if we receive the first one who I would like to inform all the participants, type them in the chat box and we will deal with the questions after all 3 speakers have given their lectures. So we are open to any question about the concern about your pregnancy. On to our next speaker. Very interesting topic again. So of course, after you deliver, you have your baby with you now. And so we talk about breastfeeding and infant care. And there's no other better person who can give us professional advice except Dr. Elaine, who is an active consultant of the Department of Pediatrics of the VRP Medical Center. may I call on Dr. Yu to give us her very informative lecture on the baby. Thank you, Dr. Yu.
Okay. Good morning, Dr. Alkawili. Good morning, everybody.
Good
Thank you
morning
ho for
po.
morning. Thank you ho for staying up until the third lecture. Sabi ho nila ang boses ko ay napaka-monotonous at baka makatulog kayo. Sabi ko okay lang basta hindi yung speaker ang makatulog po. I will just teka lang mukhang there. Okay. So my topic for this morning is breastfeeding and infant care. So the outline of this lecture would be I will talk about how your baby is being taken care of even before your baby is delivered at the delivery room, when the baby is delivered at the delivery room, tapos when your baby is roomed in with you, and how to take care of your baby when your baby is at home. And then I will incorporate the topic on breastfeeding in the middle of the lecture. And I'll also talk about the vaccines that are given for to your baby and also the tests done. Okay, so this is the picture of the labor and delivery room at the OB complex at the 4th floor of our hospital. So when you go in, one of the rooms, ito po yung kanilang main entrance. But when you go inside, there are still rooms inside, yung labor room, tsaka yung delivery rooms. And then this one is the examination room. Once you get in, for example, sabi nga ni Dr. Chu earlier, when you're already in labor, of course, you'll go to the hospital and they will be examining you first at the examination room to see kung to examine your baby, if the baby's heartbeat is okay. And then the OB will also check, will do an internal examination to see if you're already about to deliver yung cervical examination. So at the labor room, wag ko kayong mainis sa amin kasi usually, di ba, pagdating sa hospital, especially ang VRP, it's a training hospital. We have interns, we have residents, and consultants. So minsan ang dami nagtatanong, but it's all for complete information because so that we will know what to expect when your baby is delivered. So for example, at the labor room, i-interviewin kayo ng OB, interviewin din kayo ng pedia, especially yung naka-duty na resident. So they will ask, when was the last menstrual period? Ano po yung ultrasound findings? Full term ba or premature si baby? Kasi kapag ang baby is preterm, mas maraming preparasyon na gagawin ang pedia ninyo. But if full term, medyo mas relax kami. So less problems anticipated. And then they're gonna ask, is it your first, second, or third pregnancy? Because if it's your fourth pregnancy, then we'll be expecting that your baby will be delivered faster than the pregnant woman who is on her first pregnancy. And then sorry po, ayusin ko lang. Is the slide clear po or may nakaharang?
It's clear, Dr. Yu.
Okay. So hindi po nakaharang yung speakers on the side
No,
po. Okay,
no po.
thank you.
Okay
That's my
naman.
view pala po. Okay, thank you,
Yes.
Dr. Okay, so this one, okay, so it's also important to ask the mom if the mom has any illnesses, like does the mom have hepatitis, or on the blood was she found out to have hepatitis B, meaning she's just a carrier pero no symptoms? Because if the mom has hepatitis B, she can transfer it to the baby during delivery. If the mom has UTI, the baby has a tendency also to have infection, but not necessarily, especially if the UTI was treated. UTI means infection of the urinary tract. And then gestational diabetes also. If the mother was found out to have diabetes, chances are the baby can turn out to have high blood sugar or low blood sugar or normal also, especially if the blood sugar of the mommy was controlled during pregnancy. Also hypertension. When the mom is hypertensive, sometimes yung baby, paglabas, they are too small. So these are medyo makulit na questions we ask. Minsan nga in labor na tapos magtatanong pa kami. So these are all for the sake of your baby. So this is how the delivery room looks like. So on the right side is the delivery room where the mommy lies down. And then on the left side is the warmer. It's where the baby is placed when we examine the baby while in the delivery room. So now, then na-interview na yung mommy, tapos nanganak na. So upon delivery, we usually call it, "Uy, baby out na, baby out." So what do we do when the baby comes out? So our priority is still the bonding of the mommy and the baby, because so that hindi ho magulat yung baby paglabas. Kasi imagine, the baby was in the mom's uterus for 9 months and then the baby comes out, syempre maninibago yan. Very noisy environment, different temperature. So we, as much as possible, make it less stressful for the baby so that when the baby comes out, relax pa rin po. So, but of course, we want the baby to cry. Hindi naman po relax na hindi umiyak kasi there might be something wrong with the baby if the baby doesn't cry right away. So what do we do upon delivery? So this is what we call the unang yakap. So unang yakap is otherwise known as essential intrapartum newborn care or EINC. Some call it ENC. So it has 4 components. First is there's immediate and thorough drying of the baby. So pagkapanganak, di ba, what you usually see sa mga palabas, tinatapik yung puwet, tinataob, binabaligtad. We don't do that. So what we do is we dry the baby with a warm cloth and try to rub the back. So hindi naman natin i-stressin yung baby, babaligtarin ng papatiwarikin siya. So we just dry the baby. While drying the baby, we try to stimulate yung baby, especially kung yung baby tulog pagkapanganak, we want them to cry as a sign that okay yung breathing and the heart is okay. And then there's also properly timed cord clamping. So what does this mean? So, di ba, we have this yung tinatawag nating pusod. Sa medical term, it's called the umbilical cord. It's the one that connects the baby to the mommy. So, ito pong umbilical cord is the lifeline of the baby. This is where the blood and the nutrients come from the mommy and goes to the baby for the baby to be alive inside the uterus. So, when the baby is delivered, of course, this umbilical cord should be cut. So, we properly time it. What does this mean? Hindi siya pinuputol kaagad. We wait for about 1 to 3 minutes before we cut it. Why? So that a little more blood from the mommy will go to the baby. So, afterwards, when it goes to the baby, we cut the umbilical cord. So, to prevent anemia. So, alam naman po natin, when there's more blood, less anemic po. And then third is skin-to-skin contact with the mom. So why do we do this? So that the baby will already feel warm and then the baby will already smell the mommy, para familiar na ho siya sa amoy ng mommy, para start na ho to ng breastfeeding niya kasi para alam na niya na ay ito pala amoy ni mommy. So tuwing didikit siya kay mommy, alam na niya, comfortable siya. So mas madali natin maengganyo na mapa-breastfeed siya. And number 4 is the non-separation of mom and the baby. So ideally, if the baby is a well baby, meaning hindi naman siya hingal, hindi naman siya sick, walang pangingitim, then they should not be separated. So what does this mean? Non-separation. So pagkapanganak, ang priority ho namin is idikit ang mommy tsaka si baby bago ho namin bigyan ng mga injections, mga vaccines, yan. So that's our priority. So also, this means that when the mommy is brought to the recovery room, the baby should also be with the mom. Not necessarily katabi ho. Sometimes the baby is in a crib. And then when the mommy is brought to the room, the baby will also be brought to the room with the mommy. So the baby will have a bassinet or a crib where she could lie down so that anytime the mommy needs, when the baby cries, she can or he can be immediately put beside mommy so the baby can feed. Okay, so these are the 4 steps of the unang yakap. So they don't necessarily be done first, second, third step. Sabay-sabay po yan. So what about for the COVID suspects or COVID-confirmed mommy? So we call this shared decision. So what does this mean? Shared decision is the mommy, the parents of the baby about to be delivered, the OB and the pedia, they will decide, ano ba, papayag ba kayo na gawin tong EINC o hindi? Kasi yung iba ang takot nila, the baby baka mahawa raw sa mommy pagka nag-EINC. Not necessarily because we're gonna observe the proper precautions also. Kasi lahat naman ng nanganganak ngayon, they put mask on the mommy. Tapos we make sure that the environment is clean. So hindi naman dahil nag-EINC mahahawa ang baby sa mommy. So as we know, COVID is transmitted through yung mga secretions. So EINC doesn't necessarily mean na mahahawa ang baby sa mommy. But we don't guarantee din na 100% hindi mahahawa. So that's why there is what we call the shared decision. The mom, the OB, and the pedia, and the daddy should talk about this. Kung ano yung decision nila, papa-EINC ba or hindi. So this is just a picture I got from the internet of skin-to-skin contact with the mommy. So when we say skin to skin, balat na balat talaga. Hindi yung may nakabalot pa sa mommy, may nakabalot sa baby. Talagang skin to skin sila kasi 'di ba yun naman yung effective na source of warmth. And then, when the baby is delivered, so we do this routine newborn care. So lahat ng newborns, we do this. So this is an SOP. So first is cord care. So yung dating style, when the baby is delivered, we really clean the cord. Tapos pag nasa room na, we clean it with alcohol 3 times a day, ganyan. But now, the trend is, you don't have to clean it as long as it's kept dry all the time. So the secret is to keep it dry all the time para hindi siya magkaroon ng infection, hindi maging moist. Kasi when the cord, the stump, yung pusod is moist, prone yan sa mga bacteria. Gustong-gusto ng bacteria yung mga moist areas eh. So baka mamaya makulog, magkaroon pa ng infection yung pusod. So just keep it dry. Yung new trend is you don't have to put alcohol anymore. But it depends on your doctor what your pedia will advise because some still put alcohol but the trending now is it's not required anymore. So option ho ninyo yan with your, you talk about it with your pedia kung lilinisin nyo or hindi. Second, so these are the newborn care. So cord care, hepatitis B infection, eye ointment, and vitamin K. So this one, so this is the picture of the umbilical stump. Tapos on the right side is yung na gupit na umbilical stump. And then this one, we also give hepatitis B. So it's routine because even if the mother is not a Hepa B carrier, the baby should still be given hepatitis B because in the future, we don't know, baka mahawa siya through blood transfusion. Although ngayon naman, we make sure that our blood are screened, they don't have Hepa B, or it can also be acquired through sexual contact. And so it's important to have Hepa B infection. And also Hepa B, the importance is sometimes if you are a patient with Hepa B, in the long run, you can have also liver cancer. It's not automatic that you'll have liver cancer, but there is an increased chance of having liver cancer if you have hepatitis B na hindi gumaling-galing. And then we also give vitamin K injection. So why do we give this? Vitamin K kasi should come from the mommy to the baby, but not a lot of vitamin K is transferred from the mom to the baby so that we give it to the baby. Para saan bang vitamin K? Vitamin K prevents bleeding. Vitamin K also is important for the immune system sa resistensya ng bata. So why is this important? Because we have encountered some babies already na during my training na hindi nabigyan ng vitamin K sa bahay pinanganak, tapos nag-bleed yung brain. So paano ka pa mabubuhay nun kung grabe na yung bleeding? So that's how important vitamin K is. And then here, antibiotic eye ointment. Why do we give this? Of course, if the baby is delivered via vaginally, so sa puerta pinanganak, sa pepe, our vagina has a lot of bacteria. And imagine the baby passing through the vaginal area with a lot of bacteria. So the eyes can acquire infection through the vaginal area which has bacteria. So we put eye ointment. But even if the baby is born via cesarean section, we still give erythromycin eye ointment. It's only given 1 dose lang ho siya. So this is how the warmer looks like. Again, this is what we call the special care unit. This area is the special care unit. VRP doesn't have a nursery. We only have a special care unit. So ano ibig sabihin yan? All newborns who are well babies, basta walang sakit, roomed in sila, kasama na sa mommy sa room. But the sick babies or yung mga alanganin na parang well baby na hindi, they're brought to the special care unit. So this is how one area of the special care unit looks like. It's a warmer, so on top of it is there's a light that keeps the baby warm. So at the special care unit, we have an open policy, open NICU, neonatal ICU policy. ICU is just beside the special care unit, which means that when open, meaning the mommy can go inside the neonatal ICU or the special care unit to breastfeed their babies. Okay, so what about bathing? So are the babies who are delivered bathe right away? Pinapaliguan ba sila kaagad? Hindi po. Why? Because the baby has to be kept warm. So there are some occasions when the baby comes out tapos sobrang gininaw, magkakaroon ng process na yung blood sugar niya babagsak. If the blood sugar becomes falls to a very low level, the child can have seizures or magkukumbulsyon po, which is of course not okay. So we don't do bathing immediately. We do it after 6 hours or 12 hours. Anyway, hindi naman po in a rush na paliguan except when the baby has HIV or the baby has COVID kasi baka mamaya may mga mikrobyo around sa skin area. That's when we need to immediately bathe our newborn babies. Okay, so I talked about what happens when the baby comes out. We give the injections, but our priority is skin to skin first before giving the injections para hindi masyado mabulabog si baby. Kailangan relax muna siya once the baby is delivered. And then once the OB says and the anesthesiologist say na, okay, si mommy pwede nang idalhin sa room and the baby is a well baby, hindi naman siya sick, nung inoobserbahan siya sa recovery room, okay, dadali na rin si room si baby kasama si mommy. So once roomed in, so we call this roomed in kasi nasa room na with the mom. So what we monitor are the following. So feeding, yung sleep ng baby, urination, bowel movement, yung pagdumi, then taking care of the pusod, making sure it's always dry, and the color of the baby because the color of the baby is very important also because they should always be pink, tapos they should not have the yellow color. Anyway, I'll discuss it later on. So it's also important to monitor the vital signs, the heart rate, the breathing, and the temperature. So every 4 hours, expect your nurse to monitor your baby. So, wag din ho kayo makulitan pagpasok sa room kasi every 4 hours so may mga magmo-monitor sa inyo ho na nurses and midwives. Not only sa inyo kundi sa baby ho ninyo. Okay, and then so here crying is okay. So do not be afraid when your baby is crying kasi hindi naman po lahat ng iyak masama ang loob ng baby nyo. Hindi naman lahat ng iyak ay may masakit. So, crying is their form of communication. Because if your baby is not crying, you will not know na hungry pala siya. If your baby is not crying, you will not know that the diaper is wet. And sometimes, they cry just so that you would pay attention to them. Gusto lang ng attention, they just want to be carried. So, yun yung mga but of course, if the baby is crying for a long time already, then you suspect that maybe something's wrong. But do not wag niyo pong isipin na lahat ng iyak ay problema ho. Ang ibang iyak ay pinapahiwatig lang ng anak ninyo ang kanyang nais kasi hindi pa naman siya marunong magsalita. So crying will be your form of communication. Okay, so there I already stressed earlier also that crying crying does not also necessarily mean that the baby is always hungry. Because some parents and grandparents, when the baby cries, papadedehin ka agad. Akala laging gutom. So, baka mamaya paglaki ho ng baby nyo, sige kayo, overweight yan. So, make sure po, hindi ho lahat ng iyak ay equivalent sa gutom ang baby. So, what are the other reasons for crying? Maybe the baby is just uncomfortable, baka may masakit, baka kaka-injection lang ninyo sa doctor nyo, sa pedia that day, so kaya umiiyak siya nung gabi. Tapos, baby might just be tired, especially in bawa, nabinyagan yung baby. Tapos, pinagpasapasahan ng mga ninong, syempre mapapagod yan, minsan maiirita, iyak ng iyak. Sometimes when the mommy takes a lot of coffee or nagsusmoke, it can make the baby irritable. And then, when the baby's bored, sometimes wala, gusto lang papansin, iiyak-iyak. Or, of course, when the baby has colic, kinakabag. So, malamang yung iba ho sa inyo na nangalak na, they've experienced yung kabag. Kahit kabag lang yan, napakasakit yan sa iba. So, it could also be a reason for the baby's cry. So, now, we go to magse-segue muna ho tayo. Breastfeeding muna ho pag-aaralan natin. So, why breastfeed? So, I will discuss why we need to breastfeed. I'll discuss the importance of breastfeeding. So, breastfeeding the answer to this is because breast milk is good not only for the baby, but also for the mommy and also for the family and the environment. So, first of all, what is breast milk composed of? So, I just want to show this just to make you see na ganun ho karami yung ingredients ng breast milk. In fact ho, sa dami ng ingredients ng breast milk, hindi pa ho lahat yan napag-aralan ng todo. We're still in the process of studying the other ingredients of breast milk, 100 plus yan. So far, this is what we know. And this is not even 1/4 of what they know about breast milk. So I'm just going to run down to discuss the more important things. So first, the breast milk has a lot of protein, specifically yung immunoglobulins. Ano po immunoglobulins? Yung mga antibodies po, di ba naging sikat po yung term na antibodies dahil po sa COVID vaccine. So antibodies are the natural protection of our body from infection. Sila po yung magpo-protect sa atin kapag na-expose po tayo sa mga may sakit ho. Breast milk also contains fats. So Akala ng iba ang fats po ay hindi okay. Of course, fats are still needed, but at the right amount, always at the right amount. So our breast milk has fat in the right amount. So what is the fat needed for? Of course, for growth, and it's also for the brain development. Our brain, the cells of our brain, the lining of our brain are also composed of fats, yung cover nila ng mga cells. So the fat is important for the brain development. And also carbohydrates. What is a form of carbohydrate? Yung lactose. Lactose is also needed for brain development. So if you notice, proteins, fats, and carbohydrates are in our breast milk. And then water, so 87%. So more 3/4 of our breast milk is composed of water. So when we breastfeed, it's okay not to give water. But if you want to give just a small amount ng distilled water is allowed. And then vitamins, so vitamin K. So breast milk has vitamin K, but there's a limited amount of vitamin K in the breast milk. That's why vitamin K at birth is very important. Ini-inject po yan sa hita. And then the minerals, it has iron and zinc, and then enzymes. What are enzymes? These are chemicals, natural chemicals in the body to aid in digestion. So para yung breast milk ko mismo na mabilis na ma-absorb sa bituka ng bata, tinutulungan mismo ng breast milk na meron siyang ingredient na tutunawin niya mismo yung sarili niya. Teka lang, baka nalito ho kayo doon. Anyway, what I'm pointing out is yung content ho ng breast milk is meron ho siyang panunaw sa breast milk itself para mabilis siyang ma-absorb sa bituka ng bata. So, yon. So, also, breast milk has hormones. Hormones po, yung mga hormones for the red blood cells to grow, hormones for the skin to grow. So, mga natural chemicals ho yan ng katawan. So, yung mga hormones po na yan, hindi ho natin yan matatagpuan sa ating milk formula. Pati ho yung mga ibang enzymes. Enzymes, actually, wala rin ho yan sa milk formula natin. So also, ito, cellular components. So what do you mean cellular? By cell, we mean, di ba, what a body is composed of, yung mga living tissue, yung buhay na parte ng ating katawan or ng any living thing. So the cellular components, it means that the milk has white blood cells. So white blood cells are the soldiers of our body. So they are the ones that sila po ang kumakain sa mga bacteria at mga virus, mikrobyo. Sila po ang lumalaban sa mga mikrobyo para hindi ho kumalat sa katawan at hindi tayo mahawa sa sakit po. Also, breast milk has probiotics. So ito rin ho, medyo familiar din po ang karamihan sa inyo. Probiotics, otherwise known as good bacteria. Probiotics are good because sila po ang nakakatulong para yung resistensya ng bituka natin ay tumibay po. So a little bacteria is good for the body. So yan, so they aid also in digestion of the milk and they also prevent infection. Okay, so ito lang po yung I guess kailangan nating maalala is the breast milk is good for growth. It's also good to prevent infection, and it's also important for brain growth. So when is breast milk enough? Breastfeeding is enough for the first 6 months, but if you want to breastfeed longer than that, then by all means, go ahead. Kahit hanggang mag 2 or more yung edad ng babies ninyo ho. So breast milk has complete nutrients. So proteins, fats, carbohydrates, minerals, water, everything that a baby needs for the first 6 months, it's all in your breast milk. But beyond 6 months, you should already start feeding your baby because the breast milk is not enough anymore. So, suporta na lang ho yung breast milk. Try feeding your baby already when the baby's beyond 6 months. So, this one is just comparison of the breast milk and the milk formula. So, I'm just trying to stress here that hindi ho lahat ng contents ng breast milk ay nagagaya ng milk formula. So far up to now, wala pa hong nakagaya sa breast milk kasi ganun ho siya ka-magical, ganun ho siya ka-mysterious, milagro ho siya from the Lord na hindi pa ho siya magaya ng mga milk company. So, so here, for example, protein. Breast milk and milk formula both have protein, pero mas quality yung protein ng breast milk kasi hindi siya magkakause ng obesity. Unlike some proteins incorporated in milk formula, they can cause obesity. Fats also, sa breast milk and milk formula, they both contain fats. But ang advantage ng breast milk is meron siyang lipase. What is lipase? Lipase is yung tumutunaw sa fats para ma-absorb properly ng katawan po. And then vitamins. So the breast milk has vitamins except for yung vitamin D. Kapag ang mommy po hindi nagpapaaraw, kulang sa vitamin D, sometimes the breast milk will also lack vitamin D. So it's very important to take advantage of the sunlight in the Philippines. So magpaaraw po para dumami ang vitamin B ng nanay, para ang vitamin D, vitamin D, hindi po B. Vitamin D ng mommy ay dumami para ang breast milk po ay dumami din ang vitamin D na ipapadede sa inyong mga sanggol. So sometimes yung vitamin K is not enough in some situations pag kulang ang nutrients ng mom. But in general, meron naman ho kasing vitamin K na injection ng baby, so that will cover it po. So minerals also in the right amount, yung contents ng breast milk. And then here po, still compare breast milk and milk formula. So tingnan nyo, puro plus po ang meron sa breast milk. Panlaban sa infection, growth factors, so that the baby will grow, pero hindi naman magiging obese, digestive enzymes para tunawin ho yung ating mga mabilis matunaw yung kanilang dinedede at kinakain, and hormones for better growth. So there are some milk formulas who added yung mga HMOs, baka naririnig nyo na ho yan, human milk oligosaccharides. So these or milk fat globule membrane, MFGM. So they say that these also have an effect of preventing the infection from the babies, but hindi na ho magagaya exactly kung anong meron ho sa breast milk. Kasi meron ba ang milk formula na mga white blood cells? Wala ho. Meron ba ang milk formula na antibodies? Ay wala ho yan. So that's the advantage of yung breast milk po. Okay, so this is what the breast milk looks like. So colostrum po, yun yung unang labas ng gatas. And mature milk po, yun yung after about 1 to 2 weeks, magiging mature milk na ho yung tawag. So some parents, when yung unang labas ng gatas, akala nila madumi kasi kulay dilaw. So do not mistake it has madumi po na walang sustansya, kasi in fact ito ho ang pinaka the best to na makuha ng baby kahit patak-patak lang, because it is rich in antibodies, lalo na ho ngayon COVID pa rin. So it has a lot of antibodies which will protect your baby from infection ho. So colostrum is what we call it. We even call it liquid gold kasi I guess it's color gold, yellowish, and gold kasi yung ingredients niya po walang makakatulad. It's priceless po yung contents ng ating colostrum. Wala hong makakagaya niyan. Okay, so what's the difference between colostrum and mature milk? Yung mature milk po is yun nga, after 2 weeks dun pa lang po natatawag na mature milk. Colostrum is high in proteins, and proteins are what compose the antibodies. So it's therefore if it has a lot of antibodies, it's also considered the immunization, yung unang bakuna po ng ating babies against diseases. So why is it color yellow? Because it is high in vitamin A. We call beta-carotene. Beta-carotene or vitamin A is important for eye development, para maging malinaw po ang mata, for brain development, and also to fight infection ho. So hindi lang ho pangmatayan, and also it's good for the skin, pampatibay din ho ng lining ng ating bituka, ng mata, tsaka ng balat ho natin. Okay, so why is breastfeeding good for your baby? Siguro naman po sa dami ho ng contents nung breast milk, makukumbinsi ko naman po kayo na it really is advantageous, not it's really advantageous for your baby. So anong epekto ng mga contents ng breast milk? Ito ho ang mga makikita nating effect. So there is a decreased chances of the allergies for the baby, yung eczema po, yung skin asthma, or bronchial asthma, yung asthma ho sa baga. Decreased chances of the baby being obese, decreased chances of having diabetes for the baby. So less lung and ear infections, less colic, kasi yun natutunaw kaagad yung dinede nila, so hindi sila feeling full sa stomach pagka nagdedede, hindi sila kabagin, less constipation, less diarrhea, because the probiotics in the breast milk will make the function of the intestines better, so that less constipation and less diarrhea. Increased IQ, bonding with the mom, the baby is more comfortable and happy. Tapos it's always also available at the right temperature and at the right amount. So hindi na kailangan magpa-init ng milk, kasi warm na yan paglabas ng milk sa breast ni mommy. So it also has complete nutrients, as I mentioned earlier, needed for the first 6 months. Okay, so why is breastfeeding good for the mommy? it prevents anemia. So ano naman kinalaman ng breastfeeding sa anemia? So what happens is when the mom is breastfeeding, a hormone called oxytocin is produced by the mom's brain. That oxytocin will make the uterus, yung matris po nila, para mag-contract o lumiit. Pag lumiit yung matris po, hindi ho siya masyado magdudugo. So, less blood loss, less anemia. So, hindi po magiging maputla si mommy kasi pag anemic po, mahihiluin ang ating katawan. So, yun po ang advantage niyan at mabilis mapagod. Next is, why is also breastfeeding good for the mommy? There is less fat retention after pregnancy. Mas magiging slim si mommy. So, what does this mean? Kasi ho, pag nagbe-breastfeed tayo, yung fat stores ng mommy, ginagawa ho siyang ingredient ng breast milk na nadedede ng mommy. Aside from the calories coming from the mommy also. So, part of the fat stores of the mommy is used as fuel for breast milk production. So, less fat ho sa mommy. So, also breastfeeding is a form of contraception or natural family planning method, but it's not a guarantee ho. So, hindi ho lahat ng nagpo-pure breastfeed automatic hindi po nabubuntis. So, pwede rin ho silang mabuntis. But for some, it is a form of contraception. So, it also prevents breast and ovarian cancers. It prevents osteoporosis, meaning yung nagiging malutong po yung ating mga buto, lalo na pagka menopausal na at senior. So, therefore, pag hindi malutong ang buto, less prone to have hip fractures, especially pag senior na po ang mommy. So also, there's less risk for heart disease, stroke, and diabetes for the mom, and it saves time, it's convenient, and more rest. Kasi if you have to prepare the milk na galing sa bote, babangon pa kayo, alanganing oras every 3 hours, tapos magpapakulo pa ng tubig, tapos nun, isi-sterilize pa yung bottle. So, ang daming hassle. Unlike if breastfeeding, pag umiyak sa baby, itaas lang yung inyong t-shirt, salpak lang dedek kay baby, ayan, parehas kayong makakatulog kaagad-agad. Okay, so why is breastfeeding good for the family naman? So, because it saves money. Of course, alam naman ho natin kung gaano mahal mga milk formula ngayon, lalo na yung mga pang high-end ho. So, definitely, pag breast milk, hindi tayo gagastos. Ang kailangan lang ho natin paggastusan is yung nutrients, yung nutrition ng mommy para quality rin ho yung breast milk niya. So also, it saves time. So hindi na ho kayo babangon sa gabi, magpapakulo na, ipapasterilize yung mga bote, lilinisin yung mga tsupon, yan. Tapos di na kayo pupunta pa sa butika, gagastos, or sa grocery, mamamasahe, kokotse, gasolina para bumili ng gatas para kay baby. Also, it's also good for the family because if you're breastfed, you are less sick. Therefore, that means less hospital visit. And therefore, it means less money and time spent. So, hindi na kayo magbabayad ng doctor's fee, hindi na kayo magbabayad ng gasolina o parking fee pag nasa ospital ho kayo. And now, why is breastfeeding good for the environment? Kasi less trash. Kasi, di ba po, yung mga milk formula, may mga containers yan. So, less trash ho yung makakontribute natin. And if the baby is breastfed, the baby will grow up to be hindi sakitin na bata. The baby is going to be parang kapaki-pakinabang na Pilipino sa ating bansa dahil hindi siya sakitin, magiging efficient siya sa trabaho. So, it will parang help for the better functioning of the community or the workplace where the person is working. So, what I'm trying to say is hindi magiging sakitin ho paglaki yung tao, so mas magiging productive po siya and mas magiging swabe ho ang trabaho kasi hindi absent ho yung empleyado na na-breastfeed siya nung baby pa siya. Okay, so breastfeeding is best. So paulit-ulit po tayo dyan. So these are just questions on that might help pag nagbe-breastfeed na ho kayo. So first, how will I know if my baby is hungry? So what are the hunger signs? So hindi ho lahat ng iyak, inuulit ko, ay gutom. So what are the hunger signs? So usually, alam natin na gutom sila kapag when they're sleeping, tapos gigising ho silang konti, didila-dilaan nila yung nila, labi, sisip-sip-sip-sip, tapos medyo bubukas yung mata, tapos iingit-ingit ng konti. Pagka ganun ho, gutom na si baby, feed them already. Do not wait for your baby to cry for a long time before feeding them. Kasi ho, if they cry for a long time, mawawala na ho sila sa mood. Ayaw nang dumede, gusto patahanin muna bago dedede ulit. So, it's important that you're aware of the feeding signs, yung mga hunger signs, the feeding cues para pagka meron sila nun, padedehin na. So yan, bubukas niya yung bibig, dila, lalabas yung dila. O kaya sumisip-sip kahit wala namang laman sa bibig. Tapos minsan, naghahanap, titingin sa kanan, titingin sa kaliwa, pati yung cloth beside them, dinidila-dilaan na. So when you see that sa baby ninyo, feed your baby already. Yan, I already mentioned yung pag may mga sound, gutom na siya. Pero may ibang babies, kahit na ang tagal umiyak, pag nilagay sa dede ng mommy, tigil ka agad. So, iba-iba rin ang temperaments ng mga baby ho eh. So, I just got this from the internet. So, yung early signs ng hunger is, yan, medyo gagalaw ng konti, bubuka yung bibig, tapos turning head, tapos yung pagka hindi nyo pinapansin sa ganong mild lang na hunger signs, gagawin niya, mas maglilikot. Tapos didiskarte na siya, kakainin na niya yung sariling kamay. Tapos pag na-realize niya na wala palang laman na milk yung kanyang kamay, ayun na, magwawala na, iiyak na. So that will be a late hunger sign. So basta pag konting mild hunger signs pa lang, i-feed na si baby. Next question, how long should I breastfeed each time my baby is hungry? And how frequent? So generally, when you breastfeed for about 15 to 20 minutes, that would already be enough. Pero hindi man ibig sabihin 20 minutes, dire-diretso yung sak. Syempre, magpapahinga din ng konti. Tayo man pag kumakain, hindi naman ho dire-diretso, except syempre kung nagmamadali at late na sa trabaho. So 20 minutes is enough. And how often do they get hungry? Usually, every 2 to 3 hours yan. So usually, if the baby is sleeping for more than 3 hours, try to wake them up because not all babies feed strictly every 3 hours eh. Yung iba hindi nakakaramdam ng gutom pero gutom na pala. But generally, more than half pag gutom sila, nagpapakita naman ng signs ng hunger. Kasi kapag matagal na silang hindi dumede, more than 6 hours, tinry yung i-feed, gisingin nyo, ayaw pa rin dumede, I think it's already time to bring your baby to the hospital kasi your baby might be sick kasi walang gana sa pagdede. So the babies are usually hungry every 1 to 3 hours. So some babies, they have what you call the cluster feeding. May ibang baby ho, gustong-gustong matulog, batugan. Ay hindi, loko lang po. Anyway, what I mean is some babies ho, ang tagal ng tulog, they sleep for 4 hours, 5 hours, 6 hours, and then you might worry, ay teka, baka gutom na siya, kailangan ko gisingin. And sometimes when you wake them up, they don't even wake up kasi sobrang sarap ng tulog. So, that is what we call cluster feeding kasi pagkatapos naman nilang matulog for 4 to 6 hours, pag nagising naman, ay unlimited naman ang paglalatch sa inyo. Maglalatch sila 15 to 20 minutes, magpapahinga lang ng konti, and then maglalatch na naman. So that's what we call cluster feeding. That's okay as long as binawi niya yung pagdede niya nung nagising siya para to make up for the time when the baby was sleeping. So we call that cluster feeding. What's not okay is tulog na ng 6 hours, ginising nyo, ayaw gumising, ayaw dumede, itakbo na ho sa ER pagka ganon. Okay, so why am I trying to show you the stomach capacity of a baby, of a newborn? This is so that to give you assurance na hindi po natin aasahan na pagkalabas ho ni baby, automatic marami na hong breast milk ang tutulo sa breast ni mommy. So, sa simula ho, ang expect natin na lalabas sa breast ng mommy is patak-patak pa lang ho. Pinakamarami na ho, 1 kutsarita. Ilan po ang 1 kutsarita? 5 ml. So, ang 1 kutsara po is 15 ml. 5 ml, ganun lang ho kakonti ang lalabas na milk sa dede ni mommy. But that 5 ml is already enough to make your baby full. Why? Because on the first day pagkapanganak, ang stomach po ng baby ay kasing laki lang ho ng ating thumb. So kasing laki lang ho ng holen, which is about 5 ml ho ang magkakasya ng milk. So kaya mabubusog na sila. Kaya lang, maliit lang po kasi ang storage capacity ng stomach ng baby na kakapanganak. So expect nyo po, mayat maya ho, magugutom yan. So minsan every hour, minsan every 2 hours, minsan every 3 hours po. So, but after mga 3 days, yung capacity ng stomach ng baby kasing laki na po ng isang ping pong ball, which is about 20 ml ang kasya. So, katumbas po yan ng 1 kutsara at saka 1 kutsarita yung capacity. And then, beyond 7 days old, ang capacity na po ng stomach is parang isang large na itlog, 60 ml, which is 2 ounces po ang katumbas. So, ganun na po ang kayang i-store na milk na tanggapin na gatas ng stomach or sikmura ng babies ninyo. Tapos pag adults na po, ayan, kasing laki na po ng softball yung ating stomach, ang capacity niya kaya mag-store as much as almost 1 liter, 1 litro po ng fluid. So what I'm trying to point out here is Sa simula ho, pagtiyagaan, konti lang po talaga ang gatas na lalabas sa inyong baby, but eventually on the 5th, 7th, 10th day onwards, dadami na po yan. So katulad po ng nabanggit kanina ni Dr. Chu, labor po, yung parang kailangan paghirapan po. Actually, sa breastfeeding po, ganun din po. No pain, no gain. So yan po ang reality. I'm not saying na masakit po ang mag-breast milk. Hindi ko rin po sinasabi na mahirap po. I'm just trying to say na kapag ka po hindi nyo pinagtiyagaan na i-breastfeed ang baby nyo po, ay nagdebo na po siya, wala pa rin pong lumabas na breast milk sa inyo. Kailangan po kasi, try nyong ipalatch, ipadede si baby every 2 to 3 hours para maramdaman po ng katawan nyo na may nangangailangan. So ang effect po nun, yung utak po natin will produce prolactin. Yung prolactin po, ang gagawin niya, sasabihin sa gatas, uy, mag-produce ka na more milk kasi meron palang dumidede, may nangangailangan. So lalong magpo-produce ng milk ang mommy, so lalong dadami. So in short, kapag wala hong dumedede, wala hong lalabas na gatas. Kapag hindi bine-breast pump, wala hong lalabas na gatas. Basta magtiwala lang po, magtiyaga na magkaka-breast milk kayo after 1 week ko. Asahan nyo, marami na yan. So sa mga na-encounter ko po na mommies, swerte na po yung mga 2 o 3 na pagkapanganak, ang dami na hong breast milk. Usually na-encounter ko more than 5 sa kanila po, kakaunti lang talaga, which is normal po. So do not expect na pagkapanganak, marami ka agad. Kailangan ho pagtiyagaan para dumami po. The more na mag-breastfeed, the more na dadami. Lagi po po itong hinahalin tulad sa iced tea po. Di ba po minsan unlimited iced tea po tayo sa restaurant? Pagka po, if we drink half of what was given to us, the waiter will come back and the waiter will give us half, will fill up the bottle, the glass with iced tea. So they're gonna give us half. But if we consume the whole glass of iced tea, the waiter will come back and give us a whole glass of iced tea. So kung gaano po karami yung tinatanggal natin na gatas sa ating dede, ganun karami ang ire-replace na milk ng katawan natin. So kung kada dede ho, hindi na empty out completely ang isang breast, kailangan po empty out siya totally para po yung katawan mag-produce more to completely fill it up. Kasi kung kalahati lang po ng milk ang na-empty out, gagawa lang po ng gatas ang katawan natin para i-fill up yung space na kalahati na walang breast milk. Pero pag na-empty out yung buong breast, wala na ho talagang gatas na laman, ang gagawin ng katawan, pupunuin niya po ulit yon. So it's very important when your milk is already overflowing, and your baby, hindi na po niya kayang ubusin yung lahat ng contents ng breast ninyo, make sure po that you pump out the excess milk para hindi kayo magkaroon ng breast engorgement, yung sumasakit, namamaga, yung iba po nilalagnat pa po pagka ganun. Okay, so next, how will I know if my baby is full? Paano natin malalaman na busog? If he turns away, tinatanggihan na po yung gatas, yung inyong breast, ay tama, yung inyong dede kasi busog na po siya. Or yun, ayaw na magdede kasi busog na. Sometimes, babies fall asleep while breastfeeding. So kasi busog na sila, ginawa na lang hong pacifier yung dede ninyo. So as long as they fall asleep, that means busog na ho sila. So next question, ito common question ho yan. How will I know if my baby is getting enough? Busog po ba siya? Paano ko malalaman, Doc? First, if he falls asleep after feeding. Pero ibang usapan naman ho, kung 1 minute pa lang tutulugan na kayo. Ibang usapan na yun, baka sick po si baby. First is, if she falls asleep after feeding, mga after 20 minutes, makakatulog, okay na po yun. Next is urination. So, the urine is a sign that the baby is not dehydrated. What will we expect? During the first 24 hours of life, if your baby pees 1 time, that's already enough. But it is only a sign that the kidneys of your baby is functioning properly. It's not a sign that your baby is getting milk adequately. But when your baby turns 1 day old, so 24 hours old up to 48 hours old, your baby should pee 3 times in a day to make sure it's an indicator, a sign yun na your baby's having enough fluids in the body, enough breast milk. But when your baby turns about 4 days old, dapat ang diaper changes na may wiwi at least 4 times or 6 times or more. So ako, what I advise is when the baby, the magic number is 4 days old. When your baby is 4 days old, dapat at least naka 4 diaper changes siya. So naalala ko po tuloy yung lecture ni Dr. Chu kanina, sabi niya yung 411, o madaling tandaan kasi magic number sa atin po is 4 din. Dapat pag 4 days old po si baby, at least 4 diaper changes or more po. Pag more wiwi na may more diaper na may wiwi, much better po. Yun lang po yung minimum, at least 4. And then daily bowel movement. So some worry that if their baby is not having daily na pagpupo, they would think na their milk is not enough. So it's not a measure. So ang mas measure natin is yung wiwi. Because some purely breastfed babies, they they poop after each breastfeed. So yun, okay lang yun. But some, they don't poop after about 2 to 3 days, saka lang sila pupupo, considering na breastfed yan So what's the reason for that? Kasi lahat kasi halos ng breast milk na-absorb. So pag na-absorb lahat, konti lang po yung itatapon ng katawan. So a little waste product na ipupupo. So it takes time bago makaipon ng pupo, bago pumupo si baby. That is a reason kung bakit some purely breastfed babies are not pooping every day. But on the other hand naman, yung iba naman na kada dede pumupupo, possible also for breast milk. Bakit? Kasi breast milk, remember earlier I told you it has probiotics, it has enzymes para matunaw yung milk. Also, it has a laxative ingredient, which I did mention earlier pala. It has a laxative ingredient which will prevent the poop from becoming real hard, kaya hindi constipated si baby. So it is not a requirement that your baby will poop every day as long as umuutot siya every day. So as a sign na okay yung function ng bituka niya. So the weight gain we expect per day is about 20 to 30 grams per day. But of course, you don't have to buy a weighing scale para ma-measure to. That's the reason why you're gonna visit your pediatrician regularly to check if your baby has normal growth, to see that she or he is getting milk adequately. Kasi weight gain is a sign that you're on the right track, that you're giving your baby the adequate amount of breast milk. Okay. Next. So how long should I breastfeed? So alam ko mali ho yung pagkaka-construct ng aking question, pangit yung grammar, pero I think this would clearly show what I'm trying to drive at. Is the question is, up to what age should I breastfeed? So at least 6 months po. 6 months or longer. Kung gusto nyo pang 1-year-old, 2-year-old, go ahead. Kasi 6 months, pag nakapag-breastfeed kayo for 6 months, quota na po yan. Pag beyond 6 months, bonus na po yan. Meaning yung advantages ng breast milk, makukuha na po natin dyan. Less sick babies, tapos all the nutrients needed nandyan. So yan po. But beyond 6 months, the iron content of breast milk is not enough. So dapat kakain na yung baby. And sometimes we give iron supplements. But for 6 months, sapat na po yan. Okay, next. So hindi naman po breastfeeding ang topic, tungkol naman po sa paglulungad or regurgitation. So regurgitation po is our medical term for lungad. So it's normal for babies to have lungad. Naglulungad po sila. But bakit sila naglulungad? Kasi po, normally, so this is the anatomy of our stomach. Pagka po kumain tayo, what we eat, what we drink goes to the esophagus, and then it will go po to the stomach. So this is what we call the cover, yung esophageal sphincter po. Pagka po napuno ang stomach natin ng gatas, or kung ano man pong contents, ito pong sphincter na to ay sasara. So that even if we lie down after eating, hindi po tayo naglulungad. Pero ang mga babies, bakit ang mga babies naglulungad? Parehas lang naman ho tayong may stomach. Sa kanila po, itong cover ng stomach, yung sphincter po, maluwag pa po. So that means even if the stomach is full, medyo maluwag yan. So what would you expect? Kapag po humiga yung baby, yung laman ng tiyan, aakyat papunta sa throat, kaya po naglulungad sila. Now, what don't we want about regurgitation, lungad? Okay lang pong maglungad. Ang ayaw po natin is kung nilungad nilang gatas, kung yung gatas na yon ay bumalik, pero pumunta ho sa baga. Okay lang kung bumalik sa tiyan. Ayaw nating pumunta sa baga because the milk that came from the stomach has bacteria, and this bacteria can cause infection in the lungs. That's what we call aspiration pneumonia. Pulmonya po na galing po sa mikrobyo na nasa gatas. Hindi ho pulmonya na na-COVID po. Iba po ang mekanismo ng pagkakapulmonya nito. So ihalin tulad na lang po natin ito sa isang bote po ng mineral water na maluwag ang takip. Di ba po kapag puno yung mineral water na bote na at maluwag ang takip, ihiniga niyo po, natatapon ng laman, parang ganyan po ang equivalent sa ating tiyan. So up to what age should we So ito po, kaya ko po ito in-explain, dito po, ito po ang dahilan kung bakit kada dede po, itinataas po si baby, yung tinatawag dating pagbo-burp po. So, yan po ang dahilan para yung laman po ng ating tiyan, yung stomach, bumaba po sa bituka or intestines para hindi po siya masyadong maglungad, malesen po yung chances na mapunta po yung gatas sa baga nila, hindi masyadong marami yung ilulungad po nila. Okay. So keep upright kada dede for about mga 15 to 20 minutes. Wala naman pong black and white na rule dyan. Basta ang purpose natin is yung laman ng stomach bumaba. So our assumption is when the baby turns about 6 to 12 months po, itong sphincter na to, mas mahigpit na po ang pagsara kada dede. So less na po yung chance na maglungad. So sakto naman ho sa ganong edad, yung baby po natin mabibigat na, ang hirap na pong ipa-burp. So, hindi na po kailangan sila i-keep upright kada feeding, but we are very strict for the first 4 to 6 months to keep your babies upright after each breastfeed. So, next question. Do I need to burp baby after feeding? Of course. But do you need to hear the burping sound? Not necessarily. The proper term here is to keep your baby upright, not necessarily burp. Because some babies already burp. 1 minute pa lang, tinaas nyo, nag-burp. Pero paghiga nyo, naku, napakaraming gatas na lumabas sa pisngi, hindi pa po sapat yan. What is enough? What is enough is, pag tinaas nyo po siya, siguro mga 15-20 minutes, tapos pag pinahiga nyo na po, if there's a little milk that comes out from the mouth na isang guhit lang, that's fine. Pero kung ang lumabas po isang kutsarita pa, you keep your baby upright longer. Even if it takes the whole night, the whole day, an hour, doesn't matter. As long as when you make your baby lie down, you put her on the bed, wala na pong lalabas na gatas or isang guhit na lang. So why do they burp? They burp because they swallowed air. Sometimes they swallowed air but they were able to pass it out, naiutot na po nila. So wala na po silang i-burp. Kaya yung iba magdamag, antay na antay sa burp, hindi naman po nagbo-burp. So hindi po requirement na mag-burp. What is the requirement? To keep your baby upright after every feeding for the first 6 months po. So there, until 4 to 6 months. Yan. So what are the positions? Pwede hong nakaharap sa inyo, nakatalikod. Basta what the point is, nakataas po yung half ng body ng baby, mas mataas po yung stomach kesa sa balakang niya. So sometimes I advise yung ihiga po sa una na pang matanda. So para siyang naka-semi lying down position. But you observe that because some babies hindi din sila hiyang dyan kasi nagiging C-shape, nakukuba yung bata, lalong naiipit yung tiyan, lalo silang nasusuka. But for some babies, hiyang po sila kasi naka-straight body po and the stomach is higher than the intestines. So less lungad po. Okay, so my baby sleeps most of the time. Is this normal? So yes, it's very normal. The babies, for the first few months, they will sleep for as long as 16 to 20 hours. That's the reason why they grow fast. So kaya may katotohanan po yung sinasabi ng ating mga lolo-lola na, oy, matulog ka sa tanghali, sa hapon, kasi kung hindi ka tatangkad. May katotohanan po yan because the longer we sleep, the greater the amount of growth hormone produced in our brain, so the more chances of growing po. So totoo po yan, pag natutulog, mas tatangkad. Pero syempre, kapag lampas na ho ng 18, 21 years old, ay sorry na po, tapos na ang ating growth period. So, yung 16 to 20 hours of sleeping, what I mean there is hindi naman po straight. Pag pinagdugtong-dugtong po lahat ng hours of sleep in a day, ganyan po ang magiging total niya. So, but of course, aside from sleeping, kakain din po sila. So, ang sarap ng buhay ng mga babies po, kain tulog lang po sila. So, they will be asleep for about 1 to 4 hours and they will be awake for about 1 to 2 hours. So, usually, the amount of daytime sleep is equal to the amount of nighttime sleep. So, sorry po sa mga new parents, puyat-puyatan muna ho tayo. Pero don't worry ho, nothing is permanent. Pati po sa inyong pagpupuyat, pagpatak ho ng 6 months and onwards, mas makakatulog na po kayo better kasi mas tulog na po si baby sa gabi. Pero sa ngayon po, asahan nyo, puyat-puyat pa ho tayo for the first 6 months from birth. And some babies are even more awake at night than during the day. So, yun, pang call center po na schedule. Next question, how often will my baby urinate? So just a reiteration, for the first 24 hours, it's okay if your baby pees 1 time, but beyond 24 hours, at least 3 times in 24 hours. And our magic number, 4 days old, the baby should pee 4 times in a span of 24 hours or more when the baby turns 4 days old. So what's the danger sign? Ano yung ayaw natin? When the baby doesn't pee, wala pang wiwi sa diaper for more than 6 to 8 hours. That's a sign that your baby is dehydrated. Oras na ho para itakbo sa ospital para ma-check siya. Okay, how how often will my baby poop in a day? So for the first 48 hours, masaya na po kami kung makapupo at least once para sabihin namin na wala hong abnormality sa structure or anatomy ng bitukan nila. Kasi kung 48 hours wala pa rin pong pupo, baka ho walang butas ang puwet ng baby, baka ho may bara ang bituka, which is possible. Pero pag makapupo ho siya once within 48 hours, then that's okay. But if the baby is more than 48 hours old, there is no exact number of times that the baby will poop. They can poop about 3 times, 8 times, 1 to 2 times, doesn't matter ho. So long as umuutot sila every day and their pupo, hindi siya puro tubig po. Because if the pupo is all water and it's 3 times or more in a day, ay diarrhea na po yan. You should bring your baby to the hospital. Now, what is the normal appearance of a pupo of a baby? Pupo po ang pinag-uusapan pero ihahalin tulad po natin sa pagkain para madaling tandaan. So ang normal na itsura ng pupo ng baby ay para siyang buto-buto ng kamatis na may tubig sa kapaligiran. Number 2, minsan para ho siyang mango shake. Minsan parang avocado shake. Minsan parang champurado. Minsan naman ho parang semi-cooked scrambled egg. Lahat po yan normal. Kailan po magiging sausage type solid ang pupo? Pag kumakain na po, around mga 1-year-old onwards. And it's normal for the poop of baby to be blackish at the start, and then it's gonna be blackish greenish on the 4th day, 5th day, and more than a week, it's going to be color yellow. Any color is okay as long as it's not the color of oatmeal o kaya yung very, very, very light yellow. Because if that color is very light yellow or kulay oatmeal, or kasing kulay po ng aking background ngayon sa aking slides, may problema po tayo sa atay ng bata, lalo na kung madilaw po yung bata. But if the color is dark brown, green, dark green, yellow, light yellow, okay na okay lang po. And so long as wala pong dugo rin. Sometimes the pupo can be color red, not because there's bleeding, but because the mommy ingested something that's color red, kaya yun napunta sa breast milk. Sometimes that's possible. So what's the danger sign? No bowel movement for 24 hours. Kumari po nasa bahay na, no, hindi pumupupo si baby 24 hours na or maghapon. Tapos lumulobo yung tiyan, hindi umuutot, suka ng suka, kulay berde na po yung sinusuka, ay dali na po siya sa ER. Okay. Next is yung pusod. Paano alagaan ang ating pusod? The pusod should always be dry. So pag naligo po, sometimes nababasa, make sure that after taking a bath, you wipe the pusod, keep it dry, paypayan para matuyo ka agad. And another way also of keeping the pusod dry is when you expose your baby to the sunlight every morning. Okay, so the pusod usually falls, yung ating nakadikit po na pusod, mawawala, hihiwalay po yan sa katawan ng baby po, generally, between 7 to 14 days of life. Pero palugit po, up to 30 days old possible. But if the pusod is still there beyond 30 days old, then that's not normal anymore. So mahaba po yung palugit para matanggal yung pusod mula sa tiyan ni baby. So we don't advise binders or big kiss anymore. Why? Because pag laging nakakulob ang pusod, baka ho magkapawis. Yung pawis na yun, gustong-gusto ng mikrobyo, tutubuan ho ng bakterya, magkakanana po yung pusod. And also, bakit hindi kami nag-a-advise ng big kiss? Pag sobrang higpit po, mahihirapan pong huminga sa baby. Babies use their abdominal wall muscles to breathe. Kapag ka po hinigpitan yon, para huyang tayo kapag busog, napakahigpit ng sinturon, napakahirap huminga ho. Ganyan din po. So, make sure na wala hong binders. But sometimes, kapag may mga parents na gusto talagang lagyan, lalo na pag insisted ng in-laws, then pinagbibigyan ko po. Just make sure na maluwag lang po and always change the binder, always keep it dry. But ideally po, hindi na po dapat talaga nagbibigkis. And also, I think that's it po, yung tungkol sa pusod. So this is just a picture of the pusod. So ito, naka-cord clamp yan. Tapos una, ganyan pa yung color. Kasi fresh pa po. Tapos magiging yellow and then magiging itim until hihiwalay na po. So on the right side is a picture of an infected pusod. Namumula na po yung balat around. Pagka ganun, pa-check up na po kasi hindi normal po yan. Siguro hindi siya dry all the time kaya dinapuan na ho ng bacteria. So the pusod is not painful. So wag ko kayong matakot na galawin siya or linisin. Kasi po, imagine nyo po, tayo po kaya lagyan ng ganyan clip ilagay po sa balat natin sa pisngi o sa tiyan, ay napakasakit po niyan. So, unlike so that is a proof enough na hindi po masakit ang pusod. They're just crying when you clean the pusod because they just don't want to be disturbed. Ano po ang isang halimbawa rin ng hindi masakit sa katawan? Buhok po, tsaka kuko, kahit gupit-gupitin, wala pong pain. Same thing with the pusod, it's not sensitive to pain po. So don't be scared po to touch their pusod as long as you touch the pusod with clean hands. So, okay, so ayan, I'm scared to touch my baby's pusod. Pusod is not painful. So next, jaundice. So ito, baka naririnig nyo rin po. Jaundice means yellowish discoloration of the skin. So it is normal if it appears beyond 24 hours old. So pag lumabas ng 24 hours old ang baby, pag lumabas ang jaundice, okay lang po. And it should normally disappear after 1 to 2 weeks. It is not normal if your baby turns yellow bago siya mag 24 hours old, bago siya mag 1 day old. So, ano po ang reason for the jaundice? Normally po kasi yung ating dugo sa katawan, yung red blood cells po natin, namamatay po yan every 3 to 4 months. Yung namatay po na red blood cells will produce a yellow color in the blood, yung bilirubin na tinatawag. Hindi po red color, yellow color, bilirubin. That bilirubin po will be absorbed by our liver, tapos dadalhin po sa bituka para ipupo natin. Kaya po yung pupo natin may shades of yellow yan because of the bilirubin. Now, what happens in the babies? Yung atay po ng mga babies, hindi pa po 100% yung efficiency ng function. So naturally, some of the bilirubin nagsistay sa blood. Pag nagstay sa blood, makikita muna natin yan as yellow eyes, yellow face, tapos magsispread po sa legs. Tapos after 2 to 3 weeks, mawawala po yan. So yan po ang dahilan dyan. Ngayon, bakit mawawala na yung jaundice after 1 to 2 weeks or 3 weeks? Kasi beyond that, yung liver po nagpo-function na more efficiently. So yung dilaw po na nasa dugo, yung bilirubin, mas naipupupo na niya. So, paano natin maiiwasan na manilaw po? I mean, mabawasan ng paninilaw. Padede ng padede para ipupo ng bata yung dilaw. Number 2, sunlight exposure para yung dilaw po mabawasan. Not because mag-evaporate ho yung dilaw sa balat, but because yung bilirubin ho, pag na-expose sa sunlight, yung balat natin, yung bilirubin sa balat, mako-convert into another chemical form na mas mabilis ipupo ng bata. So, padede ng padede, tsaka magpaaraw. Pero pag nagpaaraw, wag naman po lagyan ng sunblock at wag naman pong balutan kasi baliwala po. Siyempre, fully exposed po, naka-diaper lang para pag nagpupuwiwi si baby, hindi po kayo mabasa. So, there. So, just remember, if your baby turns jaundice, yellow, more than 24 hours old, that's normal. Pero pag may dilaw pa po siya more than 2 weeks or 3 weeks, kailangan po silang ma-check up. Okay, so what is also done to our babies? Ito po, newborn screening. Newborn screening po is a test done by getting blood from the baby. Sometimes they get it sa heel po, tutusukan. Sometimes they get it sa ugat po, sa braso or sa kamay. So if you see here, there are 4 circles. Ganun na po kakunting drop ng dugo ang kailangan. 4 drops po. But how many diseases are tested here? Marami po, more than 11. We call it the expanded newborn screening and it's covered by our PhilHealth. So, it detects diseases that cause anemia, especially mga thalassemia, yung mga namamana po na anemia, yan, nadedetect po yan. Tapos may mga diseases din po na cause ng mental retardation, nadedetect po dito. Pero, take note po, ADHD, autism, hindi po nadedetect sa newborn screening. Hindi po siya nadedetect sa blood test. May mga certain diseases lang po na nadedetect a newborn screening. Okay. So this one, I'm just showing ho yung 5th floor, yung special care unit. This is where the sick babies are brought kapag hindi po sila naka-room in with the mom. So also what is done to our babies aside dun sa newborn screening, we do the hearing test. So some parents parang sinasabi nila yung iba baka ayaw na magpa-hearing test kasi nagugulat naman pag nagri-ring yung phone. But my argument there is, sigurado po ba kayo na 2 tenga ang nakarinig nung nagulat siya sa ring ng phone o isa lang? So that's how important the hearing test is, and ideally it should be done before the baby is sent home. But in some hospitals, small hospitals, they don't have this. It can be done basta bago mag 1-year-old si baby, because if the baby is deaf, the speech will be delayed. So, importante na malaman kaagad kasi kung deaf si baby, hearing aid lang pala ang solusyon, edi hindi madedelay yung speech ni baby. So, we call this autoacoustic emission test, hearing test. So, they put earphones on both, on the ear of the baby. Tapos, there's a small machine, portable machine attached to it. Tapos makikita nyo yung result. Pag sinabi nung type written result pass, that means pasado, nakakarinig si baby. Pag referred, that means hindi nakakarinig, but not necessarily bingi. Sometimes may konting fluid pa sa ear, so they have to repeat the test. Papabalikin kayo after 2 weeks, 4 weeks, then usually pag ni-repeat, normal naman po. Okay, so BCG vaccine, what is this is one of the vaccines given bago umuwi si baby. BCG is the anti-TB vaccine. BCG is just the initials of the French inventor who invented the vaccine, who made the vaccine. So BCG vaccine is the one that protects from tuberculosis, but it's not 100%. In the same way that COVID vaccine po, hindi siya 100% na protection sa COVID, protected lang siya sa severe COVID, ganyan din po ang BCG. So what do you expect? Sometimes your pedia will ask you, saan niyo po gusto palagay yung bakuna laban sa TB? Dito po sa balikat o sa puwet po? So sometimes they'll make you choose, but the standard is usually dito sa balikat. So it's normal to have a scar after 3 months. And the normal reaction for some is after 2 weeks, there will be like parang kagat na insekto po, parang kagat ng lamok. Then after a month, it will be like a small pimple. Puputok po yan, magnanana, normal po yun. And then 3 months after magsascar. What if there is no scar after 3 months? Do you need to repeat the BCG? No need naman po. Okay lang na hindi. Kasi napag-aralan na hindi naman po pala kailangan ulitin. Kasi nung dati po, inuulit ko yan kasi akala ko hindi nag-work. Through time po na-discover na, okay, hindi naman pala kailangan ulitin kasi mag-work even without a scar. Okay, so how long will my baby stay in the hospital? Usually 2 days po. But sometimes it may vary po depending on your OB and your pedi. Of course, when your baby is sick, kailangan gamutin mo na gumaling bago umuwi. Okay, so huwag kayong mag-alala, patapos na po to. So this is our checklist to make sure na lahat po done before you go home. Hepatitis B should have been given on the right thigh sa baby pagkapanganak. BCG vaccine should have been already given. The expanded newborn screening, it's usually done beyond 24 hours old up to 30 days old. So there's no rush na pagkapanganak dapat gawin kasi hindi pa accurate yung test na to. It should be beyond 24 hours old up to 30 days old. So kasi some parents sabihin nila, ay, Doc, 24 hours old na, kailangan naman newborn screening yan, nag-worry sila, baka ma-delay. I assure them, hanggang more than 24 hours old up to 30 days old. So we still have a lot of time to do this. In fact, yung ibang babies nga, 3 months old, doon nagpapa-newborn screening pinapagawa pa rin namin kasi may tulong pa rin naman siya. Okay, hearing test also, the cord clamp, yung puting clip, dapat natanggal na ho yan bago lumabas si baby. Okay, so these are the things that the mom should watch out for or the caretakers. First, danger sign. Pag meron nito, itakbo kagad sa ospital si baby. First is poor feeding, poor activity, poor cry. So, ano ibig sabihin yan? For example, dumede si baby, dati-dati, every 2 to 3 hours. Ngayon, 6 hours na, ayaw pa rin dumede. Gisingin nyo, ayaw, pitik-pitikin, ayaw. Dali nyo na ho sa hospital. Malamang may sakit ho si baby. Next, no urine output for more than 6 to 8 hours. It's a sign that your baby is dehydrated. Pag dehydrated, ano naman pong kahalagahan nun? Kasi pag dehydrated tayo for a long time po sa exaggerated, extreme cases, mawawalan ho ng blood supply, ng tubig blood supply sa kidneys and pwede hong masira ang kidneys. Pag nasira po ang kidneys, ano pong katapat na gamot? Dialysis na po, tsaka kidney transplant. Of course, this is exaggerated naman po. But what I'm trying to point out is you should know when your baby is dehydrated, when your baby should be brought to the hospital, when your baby is not peeing for about 6 to 8 hours. Actually, hindi lang po applicable sa babies to, miski sa atin po mga adults, tsaka mga batang medyo malaki-laki na po. So next, fever. Of course, when your baby has fever, pa-check up ka agad, especially if your baby is less than 1 month old. Kasi po, hindi ho biro magkasakit ang less than 1 month old. Mabilis pong kumalat ang infection. So pag may temp 37.8 and above, check up ka agad. When your baby has diarrhea, so 3 times or more in a day, puro poop, puro tubig, dali na ho sa hospital. Vomiting repeatedly, so suka ng suka, dali na rin ho sa hospital. Tapos, difficulty in breathing, hinihingal. So ano pong itsura ng hingal na baby? Yung butas ng ilong po, lumalaki, ganyan. Tapos ito po, maangat ang balikat. Tapos po yung ribs umaalon. Tapos dito Yan, lumalalim. Pag ganyan po, dali na po sa hospital. But it's normal for your babies na hingal sila pagkaiyak. Siyempre, para sila nag-exercise. Pero dapat 30 minutes or 1 hour after your baby stop crying, hindi na po dapat sila hinihingal. Pagkahingal pa rin, check up. And next is seizures or convulsion. So, ano pong itsura ng seizure sa mga babies? Hindi ho lahat ng nagkukumbulsyon kailangan may lagnat. Hindi ho siya requirement. Sometimes, ang seizure sa baby, makikita nyo, nangingitim na lang ho yung mukha, tapos nakatulala. Sometimes, ganyan, pumipitik po. Kahit ano pong hawak nyo, pipitik pa rin yan. Yan po ang kumbulsyon. Buong katawan pumipitik, minsan kalahati lang ng katawan. Ano po ang difference ng kumbulsyon sa nangangatog lang, yung nilalamig, yung jitteriness? Ang nangangatog po, fine ang movement, ganyan lang, parang vibration lang po ng isang instrument, ng cellphone, ganyan. Tapos pag hinawakan niyo po, magsa-stop. Ang kumbulsyon po, very rough po ang movement, very rough. So ang mangyayari po, kahit hawakan, gagalaw pa rin. So jerky po ang movement ng kumbulsyon. So pag ganun, check up na. Okay, so these are the danger signs. Okay, so next, so dinischarge na ho kayo, nakauwi na kasi well baby naman po si baby. So kailan po ang mga routine check-ups natin? Usually, the baby is discharged on the 2nd day of life. So ang next check-up niyan is one week old na siya. But if your baby is sent home, wala pa pong 24 hours, you will be asked to come back after 2 to 4 days. So ito po is suggested lang po na check-up with your pedia, but it will all depend upon yung kung anong nakita ng pedia, because if your pedia found something wrong with your baby, syempre papafollow up kayo kagad, but the routine checkup is generally pag 1 week old na siya, pag 1 month old, tapos 2, 4, 6, 9, and 12 months old. But this doesn't happen. Sometimes it happens more frequently every month because of the vaccines given to your babies. Okay, at home. So sa bahay po, paliguan araw-araw. So, pero yung iba, may mga schedule pag Biyernes daw, may pamahiin na wag paliguan or so anyway, it's your call po, basta hindi ho bawal magpaligo araw-araw. And clean the tongue and the nose daily. If we adults clean our nose daily, nagkakakulangot na tayo, ang mga babies din po, so linisin din. Why do we need to clean their tongue? Even if they are purely breastfed, sometimes so yung milk pwedeng ma-stuck dun sa dila and magkakasingaw sila. And pag nagkasingaw, hindi na ho yan dedede, baka ma-dehydrate pag maghapon hindi dumidede. So it's important to clean their tongue. Tapos just get cotton or a gauze or a clean na lampin. Wash your hands, put your finger at tas ibabalot yung lampin or gauze, tapos basain ng distilled water, tapos yun po yung ipaninis sa bibig. Clean the ears also. The ENT doesn't advise naman every day, twice or thrice a week. Tapos the diaper area should be cleaned at least once a day with soap, yung pupu, yung puwet, saka pepe or penis. But kada pupu, you don't have to clean it with soap or else magdadry yung skinny baby, baka mag-rashes siya, magka-diaper rash, mamumula. So soap once a day, kasabay ng bathing, the rest of the day, cotton with water or wipes that is adequately wet and dried after cleaning. Vitamins, it's not really a requirement because breast milk is enough for the first 6 months, but it's your doctor's call if they're going to give you vitamins because it's just a bonus. So also, it's also your call kung gusto niyo na pa-vitamins or hindi, but your breast milk is already enough even without vitamins for the first 6 months. So sunlight exposure, yun, nasabi ko na for the jaundice, and it's also good for vitamin D. When you are exposed to the sun, the skin will produce more vitamin D, and vitamin D will help you grow taller, and also it will make you fight infection better. And yun, yung sa paninilaw. Vitamin D naman, hindi na related dun sa paninilaw. It's more of for the prevention of infection and also for you to grow pagka nagba-vitamin D. Okay, what about for the COVID suspect or COVID positive mom? So for example, hindi pa sure na may COVID si mommy or sure na may COVID. So pwede pa naman mag-breastfeed. Kaya lang dapat nakamask tuwing hawak si baby, maghugas ng kamay before and after breastfeeding. Tapos, if you decide to cup feed your baby naman, for example, si mommy may COVID, naka-isolate pa sa hospital, tapos si baby nakauwi na, pwede namang mag-pump na lang ng milk si mommy, pero bago siya humawak ng pump tsaka nung mga lalagyan ng breast milk, maghugas muna ng kamay, tapos yung paglalagyan dapat malinis, so pwede pa naman idede ni baby because yung breast milk can contain antibodies that can protect the baby also from COVID. Antibodies and other illnesses also. So skin-to-skin contact at birth can still be done kahit COVID positive yung mom, pero shared decision nga, magde-decide yung mom and the doctor. So if the mom decides that the baby should be roomed in, which is pwede naman, during the time na hindi naglalatch, pwede naman silang 1 to 2 meters away, nasa crib si mommy, nasa nasa crib si baby, nasa kama si mommy. So para pag inubo-ubo si mommy, hindi masyado pupunta yung secretions, yung mikrobyo kay baby. Okay, maraming salamat po for listening and sorry po for the long lecture. That's it po.
Okay. Thank you, Dr. Elaine.
You're welcome po, Doktora.
Yes, you have covered so much for infant care and breastfeeding. Very informative lecture. Thank you for preparing all that for this webinar.
You're welcome po.
Now, Ariane, we have raffle again?
Yes po, Doc.
Okay. And then we go into the question and answer portion. Participants may type in their questions.
Dr. Elaine, you po, Doc, sorry, has 2 questions po, Doc.
And yes, and we'll have 2 questions. So yung participants can please type their questions in the chat box so we can proceed to the question and answer portion after the raffle. Thank you, Ariane.
Thank you, Doc.
Okay. Will I ask the question na po for the raffle?
Yes, Doc.
Okay. Napakadali. Is breast milk better than milk formula? Just answer yes or no. Giveaway na ho yan. Kahit nakatulog kayo habang lecture.
First to answer wins the prize. 2 questions, Dr. Elaine.
Okay. Second question is the pusod sensitive to pain? Yes or no? Okay, very good. Ayan.
Thank you, Dr.
You're welcome po.
So Ariane, 10 winners ulit or 9?
No, Doc. This will be the ano na lang, Doc. The
Grand prize.
grand prize po, Doc. I will share the screen po para live yung ano natin.
So we'll do it after Q&A or you want it now?
After the Q&A na lang po, Doc.
Sige. So we go into our question and answer portion. Parang Miss Universe. So we call back our speakers, Dr. Editha and Dr. Agna and Dr. Elaine. So there have been questions that were PM'd to me. Siguro they don't want to be identified. First, Dr. Editha, if I turn out to be COVID positive, will I still be admitted in VRP and what should I do?
Okay, if you turn out to be COVID positive prior to the admission and you feel like you're in labor, you can proceed to the emergency room 2 where we cater to our COVID suspects and COVID positive patients. Once it is determined that you're in labor, you will be transferred to our negative pressure room. So dun po kayo dun po kayo ipagle-labor po at dun na rin po kayo manganganak sa negative pressure room until you are transferred po dun sa inyong kwarto, no? So with regards to baby, kung magjo-join siya sa inyo after you deliver, sabi nga po ni Doc Elaine, it is a shared decision po, no? Okay, so you have to talk about it with your pediatrician and your husband, of course.
Thank you, Dr. Chu. So the hospital is ready for COVID positive patients who are in labor. So do not be afraid and have your swabs. There is a question, Ditas here. What is, if I'm in, Tagalog, false alarm, do I still go? Paano po pag na false alarm ako? Yun.
For false alarm naman, ano kasi yan eh, kasi like I said kanina, it's better to be sure, no, na so kung sa tingin mo,
leave it with our other luggages.
sa tingin mo false alarm pa, punta ka na rin sa hospital para lang we can check, no, if you're really or in labor or not, no. Kung so hindi ka pa naman in labor, pwede ka pang pauwiin.
So if you're not sure, just go, no?
Yes, Doc.
And then there's another related question. I get contractions, but there's no discharge. Should I go now to the labor room?
Like I said kanina, no, one of the reasons to go to the hospital is if kung wala ka pa nung is yun nga, if you have contractions, kung hindi mo pa na-meet yung 411, so like I said kanina, if you're unsure, punta na lang sa hospital. But if yun, kunyari, sabi mo, you have contractions, wala ka pang discharge, tapos wala ka pang 37 weeks or hindi ka pa term, better talaga to proceed na to the hospital para ma-check ka ng resident on duty.
Okay. Thank you, Dr. Ditas. Dr. Agna, there's a question here. Tagalog kasi. Nanganak ako natutulog. I did not see or hear my baby cry. But I want to have that. What is the best anesthesia for me?
Usually, ma'am, for epidural anesthesia naman, it's not
Ang
sedative.
ano niya, that I do not want injection in my back. Yun ang sinabi niya pala.
So we can give you mild sedation. Usually, for mild sedation, we can wake you up upon delivery. So, together with the local infiltration, we give you the mild sedation together with the local infiltration. So once the baby is delivered, we can wake you up and maybe you can take a picture together with the baby. Yan po, ma'am.
Yes, many do not want to sleep anymore. They want to see the baby
Yes, ma'am.
come out, no?
At the
So,
same time, they want to have a picture taken, ma'am.
picture taken.
Opo.
Picture generation, no? Yes. Well, I think this one was answered already by Dr. Yu, the pusod care. No? So you said just keep it dry, no?
Yes, Doktora. Some don't advise anymore to put alcohol But to be honest po, I still don't follow. Kasi ang init po sa Pilipinas, minsan pag ihi ng baby, lalo pag lalaki nababasa yung puso. Pero the ideal po is just to keep it dry. And just in case the baby takes a bath, pinaliguan po tapos nabasa, make sure to wipe off the extra soap there and keep it dry lang ho talaga. Yun ho. So it depends also on your pedia kung ano po yung i-advise. Some don't, some put alcohol. Pero here, ideally po hindi na raw pinapalagyan
Okay. So ask the pediatrician.
Yes, but the ideal po is not anymore po.
Not anymore.
Yes, Dr.
Okay. So there's a question, new one in the chat box. Ask lang po, Doc, if it's allowed to have my hair rebonded or treated 2 weeks before I give birth. And she wants to look beautiful in her pictures, Dr. Agna.
Okay, for hair rebonding, 2 weeks na lang, hindi pa tayo makahintay.
Gusto niya maganda siya sa picture.
Okay. So I understand naman po. No, when you do hair rebonding kasi these are harsh chemicals. And there are still no studies regarding hair rebonding during pregnancy, no? So syempre yung mga doktor din naman, they don't want to, yung mga nag-research, hindi din siguro nila gustong i-take yung risk dun sa mga buntes, no? Pero just remember, with hair rebonding, harsh chemicals will be applied. So these harsh chemicals, pwede kasing through your scalp ma-absorb to the bloodstream, magpunta kay baby. And the problem is there's no research regarding the effect of yung mga chemicals na ginagamit with regards kay sayo at saka kay baby. So my advice is better to withhold na lang muna on doing it until after you give birth. Kung kaya namang planchahin na lang muna with the iron. Kasi tingin mong hindi pa siya true labor or kunyari kaya pa ma-tolerate yung pain, planchahin mo na muna bago ka pumuntang ospital. Siguro.
So with the follow-up lang, this is my question already, Dr. Yu. If breastfeeding? Because I'm often asked also about the treatments for hair or facials. Do you advise against it or is it okay?
Pag talaga kung hindi mapigilan, doktora, kasi wala rin akong enough data. Pero usually kasi ho, pag hair ribbon, di ba po yung amoy lang? So I think magsuot na lang ho siya ng cap para hindi ho directly maamoy ng bata. Pero in terms of the chemicals, so being absorbed in the bloodstream and going to the breast milk, kung wala po akong mapakitang proof sa inyo, pero I think kung meron man po, halos wala yan eh. Kasi hindi naman po buong katawan nilagyan ng chemical, sa scalp lang. So I think hindi naman ho mapupunta basta-basta sa breast milk. Ang issue po dyan is more of yung pag directly na amoy ng bata. So gawan na lang ng paraan, mag-ano na lang ho, maglagay na lang ng shower cap para habang mas matapang ho yung amoy niya.
Ah,
So
so pwede
yes, pwede
talaga.
po mag-breastfeed,
Oo.
doktora. So mag-antay na lang siya pagkapanganak.
Balik alindog. Diba,
Yes.
Ditas? Okay. There's one here, Dr. Agno. Is it true magiging malimot ako after anesthesia?
There's no evidence of that, ma'am. Parang are usually the medications given after a day, it will be ano na, it'll be excreted na po, ma'am. So for inhalation medication, as long as you breathe in, breathe out the oxygen, it will go out together with the oxygen. For the IV medications, it depends usually sa kung what type of medication, but eventually it will be excreted out rin. So there's no proof for magiging makalimutin.
There's a question for Dr. Ayu. I absolutely have no breast milk no matter what I do. So my pedia gave formula. Is this like, maybe she's just saying so, no?
Yeah, it's okay, doktora.
I have patients, yes, who have done everything. They drink all the malunggay and they have all the from the lolas, but sometimes not enough.
Yes, doktora,
It's
it's
just
okay.
a statement. It's not a question.
Yeah, it's okay, doktora, kaysa naman humagutom ang bata kasi sa buhay po wala naman pong black and white. May mga rules na nabe-bend naman po. So kung wala naman ho talagang lumabas na milk, then go ahead. Pero I think siguro ang pag nagka-baby ho siya, second baby, make sure na lang ho na pagkapanganak, ayun po yung unang itry na magpa-breastfeed muna kasi baka naunahan na ho ng milk formula eh. So pag nag-milk formula, busog na si baby, hindi na siya dedede sa mommy, kada gutom. So make sure whenever your baby is hungry, kay baby muna, pagbitin sa kabilang breast, pagbitin pa rin, saka mag-milk formula. So, pero yes, I've encountered some patients so napahirapan talaga mag-produce ng breast milk. It's okay po. Hindi naman ho kasalanan na mag-milk formula. In fact, marami rin ho akong patients na naka-milk formula. All for your baby's sake. Kasi pag bumagsak naman ng blood sugar, sa kakapilit nyo na mag-breastfeed, eh mahirap naman po. Baka lalong hindi dedede, mag-seizures pa. So yes, it's okay na nakapag-milk formula kayo.
Okay, thank you, Dr. Ayu. There's a question in the chat box. Maybe Dr. Aditas can Dr. Aditas, naghang yata. Dr. Aditas, the question is how to take care of myself if I had episiotomy, from Sharon.
Okay, so after episiotomy, you can just clean it with warm soap and mild soap and water lang naman. No need na hindi na yan dinidress or ano pa ba? Hindi kailangan lagyan ng alcohol. No, it will heal on its own. Just mild soap and water lang.
So the episiotomy is the one that is done and repaired during delivery, for those who do not know the medical term. So we say no special care for the episiotomy, just soap and water can be. If you have you're using a regular feminine wash, you can use that. And so the suture or the material we use to repair is usually absorbable. It may be painful because it's in that part of your body, so you take your painkiller. Thank you, Dr. Chu. Dr. Agna, there's here. Do you do skin test before choosing which anesthesia to use in labor? From Mrs. Alura.
We usually do skin tests for pain medication, so like ketorolac, for to name a few. But mostly we take histories from the patient if they have a family history for family history for other relatives that had undergone anesthesia, then afterwards have a effect. So for inhalational anesthesia, we usually dreaded yung malignant hypertension. So we extract histories for that. For other medications, we give IV test dose instead of skin tests. We usually give a small amount of the medication before giving the full amount.
Thank you, Dr. Agna. Maybe we have room for one more. Dr. Agna, is it true that some do not have anesthesia at all and deliver? Yes, di ba? Pinanganak sa bahay. Yeah, maybe.
Yes.
Maybe our anonymous, maybe kaya pinipm ako.
Usually, ma'am, yung mga for example, yung mga G4 or multiple gestation, hindi na nagpapa-anesthesia if they at the first or second they didn't have any anesthesia. So for the mga susunod na deliveries, hindi na rin sila nagpapa-anesthesia. But ideally, if at the first baby, if you if you want to be more comfortable, you can request it. As said a while ago, there's no indication naman. So as long as you you feel pain, and if you want to feel pain-free labor, you could request from your OB na for labor or for to
Labor
tell us na magpapakabit ng epidural or any other thing
Yes.
for that.
Thank you, Dr. Agna. There's another one from participant Tionko, GM. Very common question. Can I take a bath a day after I give birth, or how long do I wait to do so for the normal and the cesarean section? Dr. Chu?
There's no contraindication naman para maligo after you give birth, no? As long as kaya mong tumayo, papunta sa banyo, pwede naman. Kaya lang meron kasi yung mga, depende din kasi yan sa tradition, so we respect din yung mga traditions, no, kung may mga sinusunod kayo. Pero in general, hindi po bawal maligo after you give birth.
Yeah. If you want to follow your lola, no? 9 days, 1 month. And then you have your dahon-dahon, kulo-kulo. That's a very common question. I think we are, for the interest of time, okay na din. If there are any other questions, you can just forward it to our website, and we will be willing to answer. So we'd like to thank our 3 speakers for spending time with us this morning. It was a very informative webinar again for our patients and mothers to be. So we have more modules of the Alagang Ina into family planning and postpartum care and for your baby care. So we will make more announcements in our website. So stay tuned for that. I'd like to thank our participants. So we have a grand prize winner, which we want to raffle off at the end of the webinar. So, Dr. Urbanos, meron pang prize?
Yes, sir. Yes, Doc. Before we
Yes.
announce present the grand prize winner, I would just like to announce the winner of the question and answer portion.
Okay. Yung quiz after the
Quiz after the
lecture.
lecture, yung mga keyboard
Yeah.
warriors natin, Doc.
Nakinig talaga sila. Yes, go ahead, Arian.
Yeah. For our first winner, it's Mrs. Rhea Podaka, who answered the question of Dr. Chu about contractions. And then the second winner, Miss Egan Evangelista. And then our third winner, it's the question from Dr. Agna. It's Mrs. Rovi Rabadon. And then to answer the questions from Dr. Yu, Miss Zani Reyes and Miss Sharon. We will contact you po regarding how to claim your prizes here at VRP. So now we're going to go with the grand prize winner po. I'll just share this.
Ano?
Doc. This one, Doc. So we will live po yung winner natin for the grand prize winner who will win the baby care package.
Ay, akala ko round trip ticket to VRP.
Hindi ba kaya, Doc? So
Okay.
we'll call out for sponsors for that.
Okay, go.
So here is our winner for the baby care package, care of Exeltis. Thank you.
May luggage things ka kasi kaya akala ko round trip ticket.
Miss Rovi Joy Rabadon.
Congratulations,
Congratulations.
Rovi.
So that's it, Doc. That's for
So,
our winner.
We have given out all our prizes.
Yes, Doc.
Okay, so we thank all the sponsors for the activity. Of course, the VRP Medical Center Marketing Division, care of Mom Rose. And then we thank our sponsors. We have Unilab, Exeltis, Corebridge, and Medicard. We thank you for the prices. And now, let me introduce to you Dr. Zenaida Malabanan, who will give her closing remarks and, of course, invite you to our next webinar. Dr. Zeni.
Good morning, everyone. Before we end this module, let me thank the people behind its success. Our esteemed lecturers, doctors, for graciously accepting our invitation to share their expertise, Dr. Editha, Evalyn Chu, Dr. Paolo Agna, and Dr. Elaine Yu. The dynamic duo of Dr. Rebecca Agkawili, Chairman of the Alagang Ina Committee, and her resident in charge, Dr. Lady Arian Obanos, for organizing this activity. Our department chairman, Dr. Ney Abat, for her leadership. Our VRP admin family for their unwavering support, especially Ms. Rose Operania, head of VRP marketing, and Larry and Harvey from EDP. Our sponsors for the exciting prizes, Corebridge, Exeltis, Medicard, and Unilab. At sa inyo, aming mga pasyente, mahal na pasyente, maraming salamat po sa inyong pagdalo at pakikinig sa aming Alagang Ina Mother's Class. Patuloy po nating palawakin ang ating mga kaalaman upang maging mabubuting mga ina sa ating mga anak. Sana nabawasan ang inyong agam-agam sa labor at delivery, pati na sa anesthesia, pati rin po sa pag-alaga sa inyong mga batang sanggol. Mabuhay po kayong lahat. We look forward to seeing you again in our succeeding Mother's Class modules. Magandang umaga po.
Thank you, Dr.
Thank you, Dr. Malabanan. So like everybody said, thank you for attending our webinar this morning. And I'm sure you will take home lessons learned and will not be afraid to come to VRP for your checkup and for your delivery and for your baby's checkups. Thank you again. Join us for the next webinar.
Let's have our picture taking po, Doc. So we ask the participants po to open up their camera. Okay, paano mag-picture taking dito? So picture lang po, open up your camera. Okay, first page. 1, 2, 3, smile. Okay, next page po. Open your camera. Smile po. Thank you. Thank you everyone for attending. Hope you enjoyed our webinar.
Thank you, Ariane.
Pero thank you po sa mga speakers for saying yes kaagad.
You're welcome. Thank you, Dr. Aryan.
Dr. Agna, Dr. Chu, Dr.
Thank
Yu,
you po.
thank you po.
Thank you. Thank you very much.
Thank you po.
Dismiss na po kami. Okay na.
Pwede na mag-leave. Thank you,
very
Dr.
much,
Elaine.
Dr.
ah.
Natuto
Thank you
rin
so
ako
Thank
sa
you po, Doc. Thank you po.
Thank you. Natuto rin
Dr.
ako sa
Paolo.
lectures nila, Dr. Edith, saka kay Dr. Pau eh.
Oo,
Paolo.
bawal
Thank you.
magpa-rebond.
Yun ang take home mo, Doc.
Ayun yung take home ko.
Okay,
Hindi,
Doc.
talagang concern nila yan palagi.
Oo nga
Yung
po, Doc.
mga facial nila, mga ganon. Tsaka ano.
Okay, Doc. Sige
Okay,
po,
thank
Doc.
you.
Yeah.
Thank you very
Thank
much
you,
po.
ah.
Bye-bye,
See you
Doc. Thank
around
you po.
po.
Oo.
Bye-bye. Thank you.